How many are doing the presentation? Please lift up your hand. 1, 2, 3, 4. Now, you know at home when you have guests, you give them some space. And I know all of us are doing virtually, so I request those of us who are students, we can go up there doing virtually. Okay. We have students from Karumo who are just coming. They can, but those who are doing presentation, please remain there. Those of us who are students and we can follow, occupy our spaces upstairs and follow us in the place. Okay? Are we not finished? Yeah. How many are there? We can have the presenter sit at the front and the rest can at the back. But we can also share with you guys if the seats are not enough. We also have space now. If you have your smartphone, you just join in virtually and follow. As they settle down, we return. Please make sure you have your mask on and you sanitize.
Good morning. Good morning. My name is Derek Njoroge, a fourth-year student taking BSc Agribusiness Management. And I'm here to tell you about my story about agriculture in Kenya and commercialization of agriculture in Kenya. According to my experience and research, I have realized that we have three problems that are making our agriculture to lag behind and fail to achieve the necessary returns. I realized that lack of information, lack of traceability, and contact between stakeholders are the leading challenges that have led to problems that are such as low marketable surplus, lack of producer power in determining the price, lack of storage, access to storage, long chain of middlemen, malpractices, and low quality and mature products reaching the market, as well as substandard inputs. So, to help in solving this problem, I decided we came together with my friend who did not manage to be with me today to leverage on the power of technology, modern technology, and modern economic models to come with a platform that helps to overcome these challenges. So that's how we decided to come up with an application known as Rima App Project that connects farmers to markets, connects farmers with agrovets nearby for supply of inputs. They connecting farmers to experts such as veterinaries, agronomists, and other stakeholders in the sector, as well as connecting farmers to other services such as logistic services, which the smallholder farmer cannot afford. It is very difficult for a smallholder farmer to own their own pickup or a tractor. So we decided to come up with an application that connects both of them. An application that connects the farmer to transport services, to the market, to suppliers of inputs, as well as an application that enables traceability of inputs, of substandard inputs, and substandard products that reaches the market. Apart from that, our application has a feature, the main feature, that provides information which is uploaded by us from our site concerning everything that they do, every sector in agriculture, be it livestock keeping, horticulture, beekeeping, aquaculture, and all the other sectors in agriculture. So the farmer just gets into the application, creates an account, then he or she is able to access the information that if he or she wants to get into mushroom farming or fish farming, he just gets into the aquaculture sector, gets to access all the information that he or she needs. So after he or she has the information, our app provides the farmer with supply of inputs or agronots nearby. So for this feature, the Rima shop, the feature will enable farmers to connect to nearby sellers of agricultural products. So what happens here, the agrovet owner lists in the application, and when the buyer or the farmer gets into the application, when he or she wants to buy the product, the farmer is given, our application uses artificial intelligence and machine learning to provide the farmer with nearby agrovets that offers the same product, the product that the farmer is willing to buy. So what happens here, if the product turns out to be substandard and the farmer launches a complaint, we will be able to use our data to track, because our application allows us in the backend to mine the data. We know the kind of input that the farmer bought from the agrovet, we'll be able to trace. We'll be able to trace where the farmer bought which agrovet the farmer bought, who sold it, and when the company that manufactured the product. So if the product turns out to be substandard, companies such as Meru will use our data to trace the agrovets that are selling substandard products from them. So we will be able to directly trace the agrovet that sold the substandard product, thus reducing the problem of traceability of substandard products. So the next feature is the Lima market. For this feature, the farmer creates an account, then the farmer lists themselves as a seller or a buyer. So when the buyer gets into the application, he will either choose the option to buy or sell. If he is selling, he will list the product that they are selling. When the buyer gets into the application, he chooses the category of buying, our application will rank the sellers according to how close they are to him or her. So this will help to bridge the gap between the buyers and the sellers, thus reducing the problem that the farmer has to encounter before they reaches the market. This will help to reduce wastage. This will also help to reduce price inelasticity in the market, because when the product reaches the market at the right time, the farmer will have the bargaining power to determine the price, because sometimes the farmer ends up selling products at low prices because he or she thinks that the product will get bad or will go bad within 2 days or within some few days. So another thing that our application will have, the farmer will be informed. So when he or she gets to the market, he or she does not go to the market as a commodity seller. He or she can choose to add value to his product. So our application helps the farmer to know of various ways of how they can add value to their product. The next feature is experts in the field. This feature will help farmers to access the necessary expert he or she requires in the field, such as agronomists, veterinaries, and extension officers. Another experts such as agribusiness consultants that will help them commercialize their agriculture. So what happens here, the expert will list themselves in the application, and when the farmer gets in, he or she will be provided with experts who are close to him, using artificial intelligence and machine learning. The other feature is a platform that will enable farmers and other stakeholders to post videos they will be paid as they post. So when they post the videos, they will be paid as per the views that they get. The intention of this platform is to help transfer information to other people through the online watching, such as the YouTube model. The other feature is the news. This will provide the stakeholders in the sector and also farmers with trending news, such as market trends, climate, that will help them forecast future behavior of the markets and the climate, so that they can make good decisions. So our main aim for this application is to help stakeholders and farmers to easily connect with each other and to make data-driven decisions that will help them commercialize their ventures, as well as help in traceability of substandard products that reaches the market and substandard inputs that are in the market. Our product will be a premium offering for farmers and other stakeholders who are willing to list in our platform. Our revenue model. Yeah. Our main aim is to make the platform freely accessible to farmers and all the other stakeholders, so that we can have as much traffic as possible. So if we have more traffic and people using our platform, this will enable us to use people as our main product. It will also help us to gain accurate data about all farmers and stakeholders and all the activities that is happening around the field of agriculture. We will also have information about various trends and activities in the agricultural sector. So how we make money from our platform? The first 11 stream in the short run is the offering of advertisements. Having all the details and data about the activities happening around agriculture in the country will help us attract companies, corporates, government institutions, NGOs that are consumers of agricultural, policymakers, and other stakeholders that are responsible in making, that are the best, that are consumers of agricultural data. The next thing is strategic partnerships. This happens to be our long-term vision for our platform. If we are able to have as many farmers and stakeholders using our platform, we will be able to have bargaining power in negotiations. Such, for example, if the farmer uses our logistic services, which will be which will be using a collaborative economy model, as we say, the farmer will never afford a tractor. He will never afford his or her own pickup. So those with pickups will be using their pickups or tractors, and then the farmer will be accessing their services through the application. So in this scenario that we have a demand of 1,000 pickups. Let's say we have it is a long-term vision. We have like 1 million farmers using our platform, and we need like 10,000 pickups, 1,000 pickups. That means we will be able to attract companies. And for this case, we are not going to just approach companies. We will be approaching companies that will offer us progressive technologies in the country that will help agriculture to live up to the expectation of being the backbone of the country. With such a demand of pickups, we can approach an electric car manufacturing company to partner with us and provide their pickups for us. This will help them gain market entrance, and they will gain popularity through us. So this platform may, at the end, lead to the birth of many daughters. We could end up with Rima electric vehicles. We can end up with Rima Internet that helps farmers connect to the internet. We will be solving challenges that come up as we grow, as we scale.
Thank you. Please finish up because we are fast.
So competitor analysis. The following are the likely cross competitors in the Kenyan market. We have farm Kenyans that connect producers with buyers. We have Farm. It also connects farmers with buyers. We have Mkulimayak. It also connects farmers with buyers. We have Professor that connects avocado farmers with buyers. We have Kuziangu that connects online marketplace. That is an online marketplace for goods. We also have Digital that offers data record keeping and data analysis for livestock for dairy farmers. We have Farm Drive that connects farmers to capital. We have Budget in Kononi that enables farmers to manage their budget. And we also have other platforms that are non-commercial. They are developed by government institutions such as Begu Choice, NAPIS, and CAR. Our competitive advantage is that our product, unlike other products in the market, we will be offering farmers. We will be offering it to farmers for free, which will be as a good incentive. Our model will act as an incentive to attract farmers to use our platform, as we have other revenue generation models. We also aim to generate new employment opportunities. Our platform also incorporates the entire agricultural concept. Whatever we do in traditional agriculture will be done online as we move to technology-driven society. So what we are asking as innovators, at this stage we understand that developing such a technology will need a lot of skills and expertise as well as funding. So at this stage, we are just in the prototype phase, and we would wish to get the necessary mentorship to grow and scale and to know what can work and what may not work at this level. And we also want to get more directions on how we can develop our partnerships so that we can get more from each other and come up with a good team, because we understand that this project cannot be completed by 2 people alone. We need a lot of experts, and also we need a good team that will help us achieve our vision. The platform is developed by Derek Jeroge and Daniel Ningu. Thank you.
Really appreciate it. I will give
think I lost you somewhere. What exactly does your app do? Is it for watching videos?
Our application is using every possible alternative to provide information and connectivity and traceability. So, watching videos is just a feature that enables stakeholders in agriculture to post their videos and get paid as they pass the information to others. That other stakeholders will be using the feature to watch the videos. A simple video is like just one can post. There is one thing that is very common from where I come, which is drafting trees. As a youth, I can post my videos there showing people how to graft trees. The more views I get, the more I get paid. And this will give other farmers a chance to learn how to graft.
So what specific problem are you solving?
The information, that feature will help to pass the information that the farmer requires.
Okay.
Another question? From the second question?
How effective is this new application to the society, especially to the illiterate people in society?
Yeah.
How effective is the application to the society, based on the literacy of the people?
Literacy of education or understanding. So this application will help farmers to access the necessary information that they require. Then it will also help them to access markets. It will also help them to easily access inputs.
I have a question. Who are your customers?
The final one.
So
Who are your customers?
our customers are corporates, big corporates who are willing to use our data for their marketing strategies. Such corporates will also advertise in our platform,
Corporates like this one.
such as Similarly. So if
And which market are you focusing on, and who are the competitors in the market, and how are you planning to compete with them?
so what our main product here is people.
No, I'm asking the market.
The market that we focus on is the advertisement market and the data market.
What's your business model?
Our business model operates like this. Since we have the people using our platform, we will be able to provide a specific segment of consumers of agricultural products. So a company like Similo will be approaching us to provide them with a specific market segment that is planting or using that.
business model.
Okay? I didn't get you.
Okay. In a simple sentence, the problem you're solving and where it's going to be, and how you want it to be, and how are you going to make money. Because I want to know, how are you going to run from this thing that you're doing? How are you going to make money out of it?
Our main aim is to have as much farmers using our platform to gain information and access to markets, another links in the sector. So if we have as much farmers as possible, we will have the necessary data. We will know.
Thank you. Thank you. Please clap for him. For the other presenters, please let's keep time. We have a long list of presenters today, so let's not spend a lot of time there, so that others can have a chance to present and also can give us time to ask your questions. Okay. So like we said, make sure your slides are in
the plastic
You usually find that when a patient is being admitted to the hospital and the caregivers want to get information about the patient, especially during this time of the COVID, there are so many restrictions that are being put in place such that you can't visit the patient, getting the information that is poor communication between the medical officers and the caregivers. And also, usually find most of the time the doctor, a patient is being placed in a room, the surrounding environment, let's say when there is a patient is being placed there, maybe it's too cold or it's too hot, those surroundings, they can affect the patient's reading when they are being taken. So I want to present to you a system that can be able to provide a good communication of information to the caregivers, and also to help the doctor not examine the conditions of the surrounding of where the patient is being placed in order to provide this data. So our system will use IoT sensors and an image unit, and also our designer that will be displaying the information. So our imaging unit will use a Raspberry Pi and also integrated with the Raspberry Pi camera module, and it will be powered using solar power. And also the sensors that we are going to use, we have the body temperature sensor, the heartbeat rate sensor. Those will be used to take the patient's readings, and also to monitor the surroundings environment of the patient. We use the room temperature sensor, humidity sensor, carbon dioxide sensor, and carbon monoxide sensor. And all these sensors will be connected to our ESP32 since it's one of the best platforms that can be used to pass information. This is just a connection of how the sensors will be connected to the ESP32, and then through coding and also, through coding you can be able to put your information, and it can be transferred through Wi-Fi, and you can get the data to maybe a mobile phone or a laptop. So this is how it's going to work. Mostly when you're taking the body temperature readings and also the heartbeat sensor, is going to be integrated with the other sensors. And also, apart from that, we have the pulse oximeter. The pulse oximeter, when the patient is being examined, what matters mostly is the oxygen saturation and also the pulse rate. So for the oxygen saturation, you usually find that if the room has lots of carbon monoxide, the oxygen saturation in the patient will show that it's high, and this leads the doctor to monitor other diseases and which are not available to the patient. But due to the high carbon monoxide in the room, the doctor will suspect that there are other diseases. So using this sensor, the carbon monoxide sensor, you can be able to examine the carbon monoxide in the room, and knowing its level is going to tell you whether the oxygen saturation is high due to the carbon monoxide or is high due to other diseases. So our system, we have the sensory ESP32 sensors controlling it, and also the Raspberry Pi camera module. So the sensors will take all those readings, and also a picture from the Raspberry Pi camera module from the patient, and then the information will be sent to a web server, and then the data can be analyzed and then sent to the doctor, who then shares the information to the patient, caregivers, and also the patient is they are in a good position to know. And if the patient is still active, or if the patient is still in the hospital, the system will start, and if it's not, they are not in the hospital, the system will stop. So our web server, this is an example of how it will be looking at the doctor's office desk. We have all that information that will be displayed there. Yeah, so as I said, our market mostly is the health sector, and also it can also be used. Okay, it's like a gadget that can be made using all those sensors. Can be also used to monitor the age, to keep the health in check. Like most of the old people need for their health to be checked. And also during quarantine, you find if you have COVID-19, you're saying like you want to quarantine yourself, but you don't know your status, your health status. So the gadget also can be used with help from medical professionals. You can know your status, and also it can pass information to the caregivers efficiently. Yeah, so I didn't find any other technology that can be used that has applied all this, but what I found in being used, I can say it's this is like a part of telemedicine, because that's what's being used nowadays. You find that most of the time they are using what is being used is the passing of information from the medical officers to the patient. Like a patient can be diagnosed while they are still at home, but then identify a system like this one. So using to create this system, all those sensors and all those equipment that are needed. So yes, if by provision of funds can be able to create that, and also this system can be also available to the working class, affordable to the working class, such that if you're still at home and like I've said, you in quarantine and you want to examine your health, you can do the same thing.
We invite a few questions. Nancy, is there any? Any questions to Nancy?
Nancy, what is your thing for production? How many in that project? Is it a prototype or is it something still an idea type, or is it already
No, it's still an idea.
still an idea? That's a good idea. Don't give up. Keep on doing
Let's appreciate that she used the same. Let's do the ops introduction. Then we will have the renewal inclusion drug.
there is high demand of oxygen in the country. For any other patient in an ICU unit, it requires 2 to 5 liters of oxygen. That is about 720 liters a day. For a corona patient, it requires 15 liters of oxygen. That is about 2,200 liters of oxygen in a day. So if a unit, if a hospital requires has 200 patients in ICU, that is about 150 liters of oxygen. And for corona patients, 200 corona patients require about 4.3 million liters of oxygen. But for our test, the demand of oxygen in the country right now is more than the supply that is existing. Recently, we have had the current state in the country is the breakdown of the bigger oxygen plant that was due to power failure. So we have come up with a technology, not technology but an equipment that is going to generate oxygen. So the accessibility of medical oxygen currently, we find that only the public hospital, the high public, that is the referral and level 5 that have access to the plant. We have the high-tier private hospitals that have installed units for oxygen generation. The other one is 9 out of 10. The existing installed units, 9 out of 10 they lack the right oxygen, 3 out of 10 lack adequate supply. Also the procurement procedures for supplying the gas cylinders to oxygen, those that don't have the installed units is also costly, and then the procedures are not that clear. Another one is some facilities we have to pass procedures to monitor the supply of oxygen in the human body. So the reasons for inadequacy of oxygen in the country, one, we have excessive equipment. So one equipment, installing one equipment, what we are supposed to do is that Kenya does not produce any, there is no electricity plant in Kenya. So the import duty the import duty is to import the plant itself. The plant costs about 10 to 15 million to install it and to manage it. The other one we have is the cost for setting up a production plant. For example, we install a unit 10 to 15 million. That is just importing it and having it there. But then you have to, there are other things that you need. You have to upgrade your power. You have to have maybe an oxygen integrator. Of course, the current imported plant, the amount of oxygen that is being supplied is 70% pure. But for corona patients currently, they require 90 to 95, a lot of oxygen saturation in their blood. So you also require an oxygen concentrator to also for your plant, for the unit. So we have come up with a solution to all this. We have generated a unit.
So after identifying the problem about oxygen inadequacy, we were able to come up with a local technology for oxygen generating equipment. And comparing our equipment with the imported ones, ours is 50% saving compared to the imported one. Also, it ensures continuous production compared to the imported devices. Remember, the imported devices need upgrade of power, but for our unit, it can use power that is electricity, or it can also be solar power. For the revenue streams, the market, the way we will get money out of it, one is sale of units to dispensary. Most of the equipment, the imported ones, are only found in level 4, level 5 and the referrals. But for this one, at least we can supply to dispensaries, clinics, agriculture, metal gas welding, and oil and gas industry. Also, we have the subscription. This is where we can decide with, let's say, a certain hospital that we can install for them. We pay a certain amount of money, and then from there they will be paying according to how they consume the oxygen. Then we have the refilling of gas cylinders. For those who do not wish to have the plant, we can refill cylinders for them. Also, licensing of companies to manufacture the gas on our behalf. So for the achievements, we have been able to come up with 2 units. One unit is a 4-patient unit. And I was at them and found that the units are already producing oxygen purity of 90 to 95%. And they are also able to be solar powered in case of any power shortage. So our next step is to invite the Kenya Bureau of Standards and the Kenya Pharmacy and Poisons Board to certify our units. And also mass production, this is how we will license other companies to produce the oxygen on our behalf. For the benefit, this plant, remember, it is way cheaper than the imported one. So we have increased accessibility of oxygen, reduction of mortality rate. This is where if oxygen is inadequate in a hospital and we have this, it is ensuring continuous production, we will reduce the mortality rate in case someone was to die due to lack of oxygen. Then we have reduction of congestion in referral hospitals and the level 5 hospitals. Then creation of jobs and wealth. This is where this thing needs manpower, right? So we will definitely give jobs to those who have those who will operate them. Then we return the economy from importers to exporters. We can either way export oxygen, we can fill gas for them, or we sell the units to other countries.
So since we have our first 2 successful units, the 4 patients and the 15 patients unit, we are asking for strategic partner to help in piloting. They can buy the first 2 units, pilots pilot for us. The other one we need financing, where we have only 2 units. We only know the dynamics of a 4 patient and a 15 patient. What if we get a customer that requires 100 patients? What if we get an industry that requires maybe 1,000 patients? So we need an investor to come and help us upscale our project and help us that we can generate more units. That is our team, our lead innovator, the committee, the research team, and the technical, medical engineers. Yes. Thank you for hearing about it and coming here.
Yes, Dr. Shebra. We are inviting questions to this wonderful presentation.
Yes, next time.
Any other questions?
Any questions from staff area
I think it's a very good idea. Keep working. There is still a
So maybe let me ask you a simple question. How much does it cost to produce one the 4 units and then the 15 patient units?
So for that, we charge to our business.
Another question? Let's appreciate them and see the stage.
Yes, we invite you to the workshop.
Yes, I think I visited the workshop. The workshop in the middle of the field down there. So we need to visit it and look at the progress we made when I was there and last week on Monday. So we need to see how far you've gone and what you've made so far. Thank you for listening.
Next is the design education part.
Still morning, okay. Yes, my name is Joshua Allen, and I wish to present to you an innovation on preparation of mineral nutrition bar. This part is for more in categorization and sanitation. First of all, what I want to know is currently the way mineral is sold is combined with or in this form. And in terms of consumption, it looks quite an aesthetic, such that for me I would wish to be taken mineral, but because the way it is chewed, I cannot take it. I see people who want to remain alert for long, taking coffee or tea. They would wish to take mineral, but it's not possible. I see truck drivers taking mineral, but the way it is chewed, majority are shy off. Mineral is worth over 5 billion per annum. So it's a major cash crop in Kenya. So we are proposing to turn it up from this form into this and this product. So what's the problem? First of all, chewing of mineral looks like it, primitive, and hygienic, and actually an aesthetic. I would not expect to see a student who raise us themselves with chewing mineral. The kind of people who find chewing mineral, yes, connotation associated with it. Whereas it should be a real product. Also, there is a product to assist driving. I could see people looking around. In Meru, only go to the market to see safari running. Because the still that Mirai is taken to the market itself is equivalent to safari running. Many people don't understand why Mirai is transported very fast. If Meru withers or dries, it produces it in the natural condition. So you have to continue to fresh. Otherwise, after you develop, people will do not die. Because it produces it in the natural condition. So the main problem is this. Once it dries, it produces it in the natural condition. So how are we solving this problem? And I explained that. The opportunity we have is to make a product that is hygienic to start with, that is aesthetic in terms of eating. We extend the shelf life of mineral such that it doesn't go bad within a shelf life, and the product that is acceptable. The solution we are providing, we have done this work for almost 5-6 years now. Drying mineral using different technologies. We have come up with a technology that you can dry mineral and retain its updated ingredients. And that's what the main challenge. So it retains its active ingredients, and then we package it in an infusion bag. I have, you can have one which is unsweetened, or one which is sweetened. So when you are talking about infusion bag, this is mineral. This is not tea. This is mineral. This is unsweetened, and then we have the sweetened. So operation model, we make a tea bag, we add water, and we take. Innovation testing, we have done consumer accessibility. Actually, I have given several people to take. Those who are in mineral to us, and the feedback is very positive. Who are our competitors? We are competing with those people who sell mineral matches or who sell mobile visitors. So these are the main competitors. The other competitors are together with coffee and tea. But those are different on a different class. Because those people who do mineral, the customer base for coffee and tea is slightly different from the customer base for mineral. So what is our competitive advantage? Key thing is hygienic. Our product is very hygienic. Shelf stable, so it can keep for long. But then it's a hygienic product. It's not like a product in the market. It's aesthetic. And then we offer better constant return to farmers. And when there is a supply of mineral, the cost goes down. Because they just go to the market, all of it at once. But if you are able to drive, extend the shelf life, you can maintain constant return to farmers, which is not possible in many agricultural products. And also we eliminate or reduce the high speed delivery so that there's no need of taking Meru to the market at very high speed. You can drive and get a product that is simple. You put it like in bins of this. So commercialization milestones, we have started development research to come up with this product for quite some time now. We have developed a prototype which is sweetened, and our sweetener is stable, so it's 0 calories. Not sugar, it's zero calories, stable in its natural form. And then we have the unsweetened one, which is in natural state. We have filed a patent with CP. There is we anticipate consumer assistance, and there's a lot of consumer assistance in the market. There are people who think they have to sit it down and achieve that as a social activity. So that's something that is coming forward for this. We are also anticipating technology escalation. What we talk about is the moment people realize your product is running in the market, you penetrate your operation base and steal your scale. And you find them in the market with a small. We also expect business there. There are some other questions.
Okay, so I'm asking this because I have never had any experience with VR. And a consumer, there is a case like getting overdose from maybe your product. Let's say you say the consumer wants to get to their level of high, the normal without it, and it should take 2 bucks. What is there anything that will happen if they maybe do 3 or 4 bucks or something like that?
No. That one depends on how high you want to get.
So, Professor, have you quantified, like, I always see like on keyboards or even any foods in the shelf, there are ingredients and specific percentage of the composition. I'm not a food technologist.
Yes, but that's our trade secret. We cannot discuss that because it's right and the secret.
Yes. Professor, I want to ask a question on now that we are manufacturing these and then personally I have not taken Meru, but I have ever experienced with people getting Meru. So usually people are not even in Mombasa, and then they see the northern and southern taking, especially taking very low level guidance in shades, not even in stock feeling like this one. Having to be like now we have to take a drink. We need not add the complexity of adding it vis-a-vis. Even now I go to the camera. It's all about I buy the badge and can consume it even as I'm moving on. We did not add that or make it complex to add it or then to have like some specialty shops for green gold or even just reach the next Manai machine, we need to be done talking like the way we see people open some coffee, in using coffee or tea or how do you make it simple to the low level?
Thank you. Those not true, not true, but Meru has all levels of technology. I know people who drive from Meru to Mombasa and just stream that. Enjoy it, they want it. They are proud. They order their Meru from a specific farm. They put it on the dashboard. They drive from there to Mombasa. They don't want to be seen system in the shed. I know people right now, if you keep an eye on people on the river Meru, around the river, there's some Meru that comes specific people, specific locations. Those are the premium customers. Those who don't want to be seen chewing Meru, but they don't chew. Going forward, because once it becomes a mainstream format, then it starts to go down. Actually, the system we are facing mostly is those people who sit down and want to chew Meru and as a social activity. Because they are Meru does not get high if you are not making stories and synthesis and do. But there is somebody else who wants to take the Meru. For me, I want to be allowed. I think I propose a maintenance. But if I chew Meru myself, I will start laughing at me. But if I have a glass of Meru in my car, that's like a category actually for my market to start going for. Coming with that, people are actually beyond why you became bad Meru is people who go to UK as refugees or from UNHCR. Those are taken because of what other people. From 11, they are technology in Meru. They're not productive because you have to use the hand. So by that aspect alone, taking Meru from using the hand, it makes it more productive. If you are an engineer, you could be operating a machine, but you're sitting on it.
That's one problem getting online.
Yes.
Someone is asking, is the bag, does it require only hot water for you to drink it, or you can dilute it with cold water?
It requires hot water for maximum extraction. If you use cold water, you won't get maximum extraction. You will get some extent, but not maximum.
mine is just one question.
Yeah.
Does the product have expiry period?
We haven't evaluated the expiry period, but the moment there's something we talk about when you buy something. If you reduce what we call water moisture, when you reduce the water activity to a certain level, you can keep your product forever. This measure is a dry product. How long can it last? Unless you pour water here and you raise it to water activity, that's when it starts rotting. But if you dry product and make sure there is no moisture to that product, there is what we call glass transition. It can keep forever. So we haven't evaluated, but once we reduce the moisture, the water activity to the level we want, and the package lighting, you can keep it 2 to 3 years. Yes?
I have a question. Okay, let me ask from the perspective of the Meru farmer.
Yeah.
Now, in terms of your requirements, maybe delivery or all that, maybe the quality of Meru you want to produce a certain amount of the green gold infusion bag. So, what is an opportunity for me if I have a Meru farm? Can we partner like can I supply for you? Is there an open? Is it an open business opportunity for somebody that would want to partner with you as well? For example, if I have a Meru farm and I would prefer to have you as a constant customer, and I'm sure maybe every 2 weeks or maybe every month you will require this quantity of Meru. Is it also something you can consider?
I think that one is automatic, provided we have the equipment that has a capacity that can handle your quantities every 2 weeks. The challenge now is we are doing between 1 and 2 days, between 1 and 2 kilograms, which is quite low, right? But if we have a facility that we can do the volumes, let's say a ton a day, why not?
Let that be the last question because of time. Let's clap for Professor. Next is Dilema Ekandi with Care Calc.
Good morning, everyone.
Good morning.
My name is Kirema Ikandi, and I'm the team lead for NutriCare. And NutriCare is a computer software that is supposed to integrate service delivery for the patient care, specifically management of diseases and prevention of diseases. Therefore, I see this as a software that is going to revolutionize healthcare and prevention of the diseases. So what's the problem are we trying to solve right now? Worldwide, we have a triple global burden of malnutrition. And this triple burden global malnutrition is further exacerbated by the existence of the non-communicable diseases like cancer, diabetes, cardiovascular diseases. And this, right now, according to the UNICEF, in Kenya, for instance, we have like a third of under 5 children who are undernourished. At the same number of children who are under 5, there is a third of them that are dying because of undernutrition. Also, we have more than a half of pregnant mothers who have insufficient nutrient intake. The issue at hand is that most of the cases that we have in the hospitals, that people take too long time to be served. Why? Because there is a lot of time wasted in the manual retrieval of patient data when they come for the visit. And this is very, it can be estimated that like 3 hours in 8 working hours in a day is wasted on the manual process of retrieval and follow-up of the patients. And now, this issue is further compounded by COVID-19, because again we have issues with social distancing and people are not supposed to crowd. So this software is going to provide a solution, and this is the solution I'm going to provide. I'm coming up with the NutriCare card, which is a software that has been integrated to be able to do nutrition assessment, not only nutrition, even the health assessment, that can be able to provide the vitals in the triad. This data is input in the software, and once it has been input, it's being configured, and people are able to make very informed clinical decisions. So these decisions are going to inform on the kind of care that people are going to receive. So what makes my software unique is that we have the Kenya Food Composition Table. This Kenya Food Composition Table, it was done by Food and Agricultural Organization in 2018. It is one of the unique ones that exist in East Africa right now. So I'm using this particular database for now management of diseases specifically related to nutrition. So the use of the reference levels from the Kenya Food Composition Table is different because we have other softwares that are in existence in the country, but the problem with the existing software is that they mostly borrow their funds from the international scope. So like now this one has now contextualized care to the local context. The level of innovation. This software is at prototype phase, and it has been registered with the Kenya Corporate Corporation. And this is, you can see there is a user interface that is very easy to use, even for self-assessment. Because in future we want to come up with a patient, like an individual customized software or user interface that someone can be able to do the assessment themselves, so that they can be able to identify the nutrition data and also the management of diseases. This integration with the Kenya Food Composition Table, therefore, just like I said earlier, it is going to help us contextualize this particular kind of care so that we can be able to fit in the local context, such that we are not borrowing so much from the other countries. And the things that, for instance, the nutritionist, the clinical nutritionist in hospital usually they do, is that you can be advised on, let's say, for instance, management of cardiovascular diseases like hypertension. You reduce the amount of sodium, and the kind of foods that probably they would advise are the things that they have Googled online. So therefore, based on the use of the Kenya Composition Table, we can be able to identify foods specifically that have low levels of sodium, for instance, in the management of hypertension. Now, this is my market opportunity. In Kenya today, we have 3,956 public hospitals. We have 2,652 private hospitals, and also the non-governmental organizations that have programs for management of diseases and prevention of diseases. This one provides me as an ideal market for my software consumption. Now, this is how I'm going to generate my revenue. The direct sales of NutriCare Health software to the hospitals, to the private practitioners. It can also be downloaded from the Google Play Store. You can get revenue from the download fees. Also, we can be able to get revenue from the licenses based on the contract that the agreement that we have. You can lease it for a specific duration of time, so that we can have licenses for continuous use of the application, the charges that are charged from the continuous use of the application. Finally, here are the growth plans. Right now, what we have is a minimum viable product. it has to be developed further to be able to be piloted and be able to reach a bigger scope. So what we want to do is that we want to use a USSD functionality. Specifically, this one will be targeting the non-governmental organizations that have programs in very remote places where people cannot be able to reach healthcare facilities. So the use of the USSD functionality can be able to do, as you do the assessment for the patient, it is able to, you are able to send the data to a healthcare facility, and then the kind of support that they require can be given to. Or even they can keep track. Let's say, for instance, the case of the community health care workers who have been trained on doing the assessment, specifically the physical assessment, the mid-upper arm circumference, the BMIs. They can be able to send this data to the healthcare facility in a system that is able to compile this information so that it can be therefore remitted maybe to the central unit in the government, like the DHIS2, which is able to have all the information for the patients. The other one is the Android app is another thing that I want to come up with, so that just like even if you are not sick, you can be able to use this particular application to do your assessment. You get your weight height, you'll be able to do, maybe probably also been diagnosed with a condition like hypertension or even diabetes. You can be able to use this particular application to come up with phones that you know that can be able to, that are within your accessibility, you can be able to take so that you can be able to prevent the progression of the disease or the management of the disease. The other one is the interoperability with NutriCare with the DHIS2, which is also very important. This data needs to be sent to a place where it can be able to be managed and used for policy making and decision making. The other one is the portal, patient's portal for interaction with healthcare providers, which most of the cases people want to maybe consult a healthcare provider based on the problem that they have. So therefore, when we have a portal that can be able to, you can be able to interact and reach to a healthcare provider, it will be the next, it will be an easy way to reach out to a provider instead of going to the hospital directly. And then finally, this is the request or ask. The development partners and all those people that have interest in healthcare, what I am asking is for financial support for the development of this particular software, and also to refine the software to be able to be scaled up, not only in Kenya, but also can be used in East Africa countries and beyond. And the last one is to build up an API for interoperability between NutriCare and DHIS2. Finally, this is my team. I'm the executive director, Irema Ikadi, Collins Ouko, the strategy and partnership lead, Richard Kerimori, clinical and technical advisor. And finally, good nutrition provides a foundation for human development and scaffolding needed to ensure that it reaches to full potential. NutriCare software, therefore, ultimately will contribute immensely to the improved health outcomes. Thank you very much.
Let's appreciate him. We are inviting questions to the presentation. Any questions?
Well, I was following these things online, and thank you for the conveners of this program. And I think we're in the right direction. Now, I've come in the mid-row, and I was driving also. I didn't get to get the real issues, but from what I had listened online and what you just said, so which is the main problem you are addressing here? The main, yes, you can go back. Yes, that's where my interest came.
Yes.
Now, if we look at our country policy in terms of nutritional issues, the main problem actually is not food. The main problem is distribution of this food and how we eat it. That's what I believe from medical point of view. Because you find we have a lot of maize in Kitale, we have a lot of avocados in Meru, we have a lot of managu in Western Kenya. The problem we have is how do we distribute this food? How do we do value addition with this food? How do we ensure that every child in Kenya, in northeastern Kenya, get this food? That's one of the major problems.
Yes.
I like the approach which you have taken. You've talked about communicable diseases and all that.
Yes.
So as you develop your software, I think we should be able to come on board in a way that we are addressing the real policy issues, looking at the statistics. The majority of people who are affected with nutrition issues is not the people who are mobile, it is the young and the old. Those are the cohorts which are mostly affected with nutrition issues. And when I mean the young, it's the under 5s and the geriatrics.
Yeah.
So you really need to focus on that cohort as you do that. Of course, the other thing you have tried to address it is the linkage of the DHIS and the NutriCare.
Yes.
In your market, which you are targeting also, I don't know what your interest is, but it could be more better if you are handing value to this DHIS, just that anybody who is not in medical field or any healthcare worker can really use that software to import the information which is collected in the field to the hospital care system and answer the problems which already exist in our DHIS or in our ICD-10 softwares which are in the market.
Now, let me respond to this concern. The first one is on the problem statement. That you realize in the hospitals today, if you go, for instance, let me just take it like right now, if you go to the hospital, probably you have a medic or you have a orthopedic or you have a, so you go directly to the receptionist so that can be able to be directed to the nurse or to the clinician. So what happens is that when you go to this hospital, most cases, some of the assessment that needs to be done is not done. Because mostly if they take your blood pressure, they take your weight and take your temperature, they are going to direct you to the clinician so that can be done further assessment. One area that I am targeting, because issues that arise is that when you get treated to that particular condition that you are having, there might be another underlying condition that has not been seen. For instance, the case of hypertension or the case of diabetes, they can present with specific symptoms that the underlying real problem has not been addressed. Probably it's because you are overweight. Probably it is because that when they check your lipid profile and they check your low density lipoproteins and the cholesterol are very high. But what is really contributing to this is because of poor diet practices. These are the things that are making these people to be sick. And therefore the reason why I'm coming up with this software is because we want to do a thorough assessment so that we do not basically focus on drugs, but we also do a wholesome assessment so that we can be able to identify the real cause of this problem. So it's clinically tailored specifically to manage diseases not only through the drugs, but also through nutrition. Because you go there, tell me, how many times have you ever been given a printout of that prescription of this? Because you have diabetes, this is the diet prescription that you're supposed to take. Based on, because this software again, after you have been put like your weight, height, the blood pressure, it is able to give you the actual amount of fluids that you need to consume in a day. It is going to give you the actual amount of energy that you're supposed to spend in a day. It is able to give you the distribution of these particular nutrients based on, let's say you require like 2,000 kilocalories. So this 2,000 kilocalories is distributed in terms of the carbohydrates, proteins, fats.
And that's why we are using the Kenya Food Composition Table to tailor this particular care to be able to fit in the local context, so that we don't go struggle and buy so much expensive food, so that I can be able to achieve this. The other thing is the question that you told me about bringing in the management of the issue of basically cutting on the insecurity, such that people, there is places where food is produced a lot, sometimes even it goes bad, and there are places where people do not really have this food. It is a very positive thought, and I really would want to integrate it. But right now, what my focus on management of diseases and also prevention of diseases through the use of which is locally available.
Okay. Sorry for engaging you, but I've been in medical practice for over 15, 20 years. Huh?
Yes.
And I can give you real life issues of what we experience.
Yes.
It's like we are making a tentative assumption that once that software is in place, it will solve some problems, right? And actually, I've seen your market target is hospitals, both private and public. I want you to answer my questions, huh?
Yes.
Because if I look at the hospital setup, we have a nurse there who is seated in the customer care desk. Yeah. And we have a nutritionist who is seated in the office there waiting for referrals from this customer care desk to answer questions, nutrition, and other issues. Now, I am asking, in terms of integration of this software in our DHIS system or in our system, is it going to answer those questions just on the spot, after taking the weight there? Because the first thing we do is weighing the baby or the person who is coming to the hospital. Will it link it to either obesity or malnutrition? Those are the simple tasks which the software should be able to answer before even you think of mixing the food, before even you think of calculating the BMIs and everything else. Mm-hmm. Immediately you take the weight, you will say this person is either overweight or underweight. Yeah. Immediately you know this person is overweight, then you can do the assessment. Because actually, if the weight is normal, you will not go with other things. So I'm asking, does the software capture those nitty-gritty so that on the spot, somebody is referred or somebody is advised to use the software?
Thank you very much. I actually left that one out. The software also has that right now. If you get your weight right, it is going to give you the nutrition status, and it's going to give you the classification. So that one is already factored in.
And is the cause of the problem?
The cause of the problem, no, that's one I know now. It has to be.
It is at a higher level.
Yeah.
Okay.
Yeah. Another concern. Let's appreciate Kramer. Next is biodegradation of plates. That is Moses Everton and Benway Norman.
Okay, Everton Moses. We are looking at biodegradation of plastics.
Thomas.
To be specifically, that's a PET, polyethylene terephthalate, by a bacteria by the name Adonella saccharosis in dam site. And since pollution is a major world effect currently, and it has taken of much concern, and there's much need to do away with pollution. Exposure of plastic bags, plastic materials has gone to a higher point of approximately every year there's a production of almost 4 million tons of plastics waste, which statistics are showing that if there will be any cut-off of the production of plastics or any other means of biodegrading the plastic materials or waste, there will be approximately almost 15 million tons by the year 2015, which is a higher number of plastic production. And therefore, that's why introduction of a bacteria by the name of Adonella saccharosis will give a solution to the waste or the plastic production waste. And the bacteria is not new in the market. It has been identified by scientists in Japan, and it was approved to degrade the PET plastics under a laboratory condition. And my concern with my team is to take now the bacteria under field category or field setup to determine the biodegradation of the plastic by the bacteria under several conditions. And since the genetic engineering has also been involved in the process, the bacteria has been manipulated or to ensure that it works under several conditions. And introduction of a gene of the Azobacter species to Adonella saccharosis makes it able to work under water condition, under soil condition, and any other environmental condition which may not be suitable for the bacteria to carry out the biodegradation under normal condition. And action of bacteria on PET, the bacteria works and two enzymes, that's a PETase enzyme and MHETase enzyme. The PETase enzyme break the PET or the plastic now to PET, which again is being broken down by MHETase enzyme to the end products of plastics, which are glycol and terephthalic acid. And now those are the only side effects of the bacteria and the environment. Since the bacteria are environmental friendly, the end product now of the biodegradation, that's glycol, is being digested by the bacteria as the only source of energy. And now the terephthalic acid is being handled again by the bacteria, which is being broken down to produce carbon dioxide, which can be used by the plants in the environment to carry out the photosynthesis and any other processes.
Okay, I'm Mason Lemuya, taking you through the competitive advantage. The bacteria which are about to use to degrade the plastics are very friendly to environment. The current method which are used to degrade the plastics actually are very unsafe to the environment. You find that the plastics are being collected and then burned. In the process, there is that of production of CO2, which actually contributes to the global warming, bringing about the issue of health hazards like the respiratory diseases. And on the risk, the production of bacteria requires specific culturing, that is the culturing apparatus, the culturing media, the laboratory setups, that is. And then, in terms of let us ask, we are not yet come with the exact value, but upon being supported through funding, we will come out of the implementation of the biodegradation of plastics using the Adonella saccharosis in a field setup.
Let's appreciate them for the presentation. We are inviting questions to the presentation. Will there be any concerns?
So, question. Is the bacteria safe for human?
Yeah, the bacteria has no any effect on human being or any other living animal. It's environmental friendly.
And what product are you bringing to us? Are you going to create for us that bacteria, or you will offer the service of degrading the plastic? Or you will grow it in the environment?
And
Or
then,
you are going to make the bacteria?
yes. And then also the biodegradation services.
So it's a package.
Yeah.
Then how will you make money from this?
Okay, we have bodies like NEMA, which regulate the environment, and they are much concerned of the waste management. So introducing the bacteria to them will be of advantage to them. Therefore, they have to purchase the bacteria so that to carry out the waste management processes, or more so the biodegradation of those plastics waste, and any other body or any other company that are much concerned about the pollution.
You said you are, it is still an idea.
Yeah, it's an idea.
Okay, thank you.
You don't have any prototype? Have you tested it in the labs, like maybe an experiment or something?
We have not yet tested.
So you don't know if there exists any other people doing what you're doing?
It has been tested in the laboratory and it has come successful, but for us, we want to try it in the event site.
Another concern is, can it work amidst other that, like, you know, in a dump site, plastic could be around 30%, and sewage and stuff, and let's say these other papers make up to, let's say, 40%, and then the rest is dirt, like the dirt, mchanga. Can it work in such a environment?
Yeah, it can work. That's where the part where genetic engineering has come in by introducing a gene called Azobacter species, which now ensures that the bacteria can work under various environmental conditions, either in soil, water, or any other environmental condition. Yeah, it can work.
So what do you want?
Now, our concern is now to take the bacteria now and field the setup and examine the rate of biodegradation and a certain level or amount of plastics, the time it can take to degrade the plastic, and any other modification that can be done to increase the speed or to increase the speed of biodegradation.
So you want to buy the bacteria to take it to the field?
Yeah.
How much does the bacteria cost?
The bacteria goes about 800 per almost 10 ml, the bacteria.
And how much bacteria is needed to, let's say, degrade 20 liters of plastic?
20 liters of plastics, you need almost about 100 ml.
Right, another question?
How are you planning to make money out of this? What's your business model, in other words? Are you planning just to give it for free?
No.
Why have you decided to do it? Do you plan to generate money out of this?
Yeah, we plan to generate money out of it by taking the bacteria to the companies or those bodies that regulate waste management and plastic waste. And after they purchase, now we are able to generate revenue from the selling of the bacteria.
So who will be your competitors?
The companies like the Nema.
Nema? Really?
Okay, as per now, there's no any open competitor which have the same method of doing away with plastic waste. Since the only ways which are there is those common ways of doing away with plastic waste, which all of us maybe back at home, you normally collect the plastic bags or plastic waste, you burn them, and those are the only ways which are there.
Okay, I have a question. There's another, one of the innovator was here yesterday. He was talking about using the same plastic to make gas. I think it was gas. So such a project, or how are you going to be? Because now for you, you are eliminating them. For the other person is trying to use them or something else. How is that conflict of interest?
One of the byproducts after degrading the plastic is CO2, carbon dioxide. And as we know, carbon dioxide is one of the gas used in as fire extinguisher. So it's this.
So it's all about making sure the plastic cannot being as in this to make or is it cause in a decay using the bacteria.
So, okay, I'm not getting your question clearly.
I think he's asking,
Yeah.
how will your bacteria work on those plastics? Is it going to consume the plastics, or just simplify the chemistry behind it?
Yeah, the bacteria works under two enzymes. That's enzyme PETase and MHETase. That's the symbolic representation. Now the two enzymes will break down the plastic into PET and now break down into MHET. Now the MHET, that's the end product of plastic breakdown, which will be digested by the bacteria as a sole energy to the bacteria. Now the MHET product, that's a glycol and the terephthalic acid, will be taken in by the bacteria as a source of energy to bacteria.
Now, with the chemistry and all, we are on an innovation competition, where we want to see the viability of your project in terms of commercialization. If today you want to sell your solution to someone, how would you convince them that it's going to be profitable, it's going to, get rid of plastics and it's sustainable, all that. That's what I want to come out clearly from it.
Okay, now, as per that, okay, when an investor comes to me and asks me, what's your research or project about? And now I share my idea to the person who wants my idea. Now, the benefit that will come in is that I will give my idea to the person, and now after I have tested my project or my product to the person who wants the idea, it will be of benefit to him, because maybe he is suffering from the issue of plastic waste, and he doesn't have any other appropriate way of doing away with the plastic waste. Therefore, my idea will be of benefit to him.
Thank you for that. However, it's good you go think about the business model of your innovation. Let's appreciate them as they exhibit. Next is affordable sanitary pads by Daniel. Then we have Pinoti, then Norbert, in that order. Pinoti and Norbert are from Karumo.
I'm Daniel Mwandwa, taking education science, math care. So I'll be taking you through my project which is making affordable sanitary pads using cellulose from banana stems. As you know, there is this strategy, the girls after every month they must undergo the menstrual cycle. So I encountered some problems with their sanitary pads. So I decided to use banana stems to get the cellulose from banana stems and manufacture a sanitary pad, which is affordable to the less privileged and also reusable. So my problem was to sort out that one and to ensure that the environment is conserved, because my sanitary pad will be highly degradable. So opportunity. Now I'll be using the banana stems, which are there back in the field. As you know, after using the banana, after cutting the fruits from the bananas, the banana stem is always cut and thrown away, just no use. So I decided to use that banana stem instead of throwing it in the field and coming an effect to our farms. I decided to take it, get the cellulose from it, and manufacture a sanitary pad, which is very affordable, very biodegradable and usable, because the cellulose from the banana stems have high permeability, so it can absorb the liquid for a long period. So the solution which I came with is now to go to the field, get the banana stems, and take the cellulose, extract the cellulose from there, of which I'll be using some machines to extract it. Then after that one, I'll replace, as it's not by the other sanitary pads, they use the woolly pad cellulose. Now I'll replace that one, which is very expensive. I'll replace it with the banana stems, cellulose, which will be very cheap, and I will have used the materials which has not been used in the field. Okay, now I have the competitive advantage and competitive advantages. My sanitary pad will be very reusable. So if a person is from the less privileged backgrounds, you can just buy one or two. Then you can be after every day or after every month, you can be reusing it. You can wash it, then use it again. So the sanitary pads from the cellulose, from the banana stems, they have high permeability, so they can hold the fluid for around 8 to 12 hours, of which the other sanitary pads don't hold for that. They have to just for only 4 to 6 hours. So mine is more advantageous. So I have a competitor which I have encountered. We have the company by the name of Meru. They are producing the sanitary pads, also the Sun Girl, and also the Genesis. I can see here it from here. This is also another company. So from this one is now the bananas. Now from this banana stem, I'll be extracting now the fluid, not the fluid, the cellulose from it. This is a machine, and I will liquefy them. Then use that fluid as the absorbent of the sanitary pad. So my aim is just on the absorbent of that sanitary pad. So to conclude, making sanitary pads from banana stem cellulose are cheap and quality. The use of banana stem reduces environmental pollution, as I said. So once I use the banana stem, and I would have used it in a very better way. So the budgeting of the project will cost around 100,000. Then the innovators, I will inquire some mentorship skills from the innovators who are not full of the sanitizations, and also if I get some funding to start my project, because I'm just in the idealizing phase, it will be better. Yeah, that is it.
Let's appreciate you for the presentation. Oh, you are inviting questions. I'm sorry. You're inviting questions for the presenter or concerns.
Okay. Is there any other source of cellulose apart from banana?
Yeah.
Yeah. And is there any your competitor company?
Yes, as I said, there are so many companies producing the sanitary pads, like always the Sanjal. Also, this company like the Genesis, which I can see it here, is producing sanitary pads. Yes.
This one distributed and not produce.
Okay. So we have so many commercials. Yeah. But the sanitary pads, most of them they are not reusable, and they have poor viability.
Solution.
Another question? Yes, there's a question from Malimu.
Thank you. You're Mr.
Daniel.
Yes, Daniel. Thank you for your presentation. My concern is just on the technicalities, and especially when it comes to the area you are dealing with. It's reproductive health purely. And when you talk matters women, and you can see they're here, you have to convince them beyond reasonable doubts that they should use that technology. Now, the only challenge is that this technology has been tested elsewhere. I know there's something happening in Uganda, something happening in South Africa on the same. So the nitty-gritty about it is you really need to get other partners so that you can come out very clearly in terms of your problem, especially in Kenya. In Kenya and in Meru, or in the other greater part of our country. You should clearly come up with the statistics, like how many girls who are not accessing the sanitary pads. You get? You should come out clearly, like the magnitude of the problem. So that one has not come out very clearly. Number two, you should also indicate the viability of the project in terms of uptake. Why do you think they opted for that and not continue with what they are doing? You should actually come out very clearly on that, and of course get more partners in terms of fine-tuning your innovation. Yes.
Thanks for that. As I said, I'm in the idealizing stage. So I'm just, okay, I have a partner by the name Collins. Now about the problem statement, as you have said, so maybe South Africa is doing something on the same, but me, I'm doing it for the people of Kenya, and specifically because now I'm men, I'm tackling some of the problems around men. I've done some statistics, and I saw 3 out of 10 girls, they lack sanitary pads and they use the cloth. Yeah.
Another question or concern?
Yes. How many, like how many of those banana things we're using will you require to make a quantity of maybe 10 parts?
Only one. And it will be one banana stack.
Oh.
One mature banana stack.
Okay. Yeah. So will you, because it could be will you be sourcing this banana plant from the banana grower store? Because there are some areas basically doesn't have the banana growing thing.
Okay.
Maybe within Meru and TC it's good, but what about that?
Okay. For those areas without bananas, I prefer the area like Meru and TC, where there's a lot of bananas. And the farmers, after they cut the fruit, they always draw the banana stand. If I just go there and just purchase it at a cheaper price, you know, I will have benefited the farmer. Of course, you would have cut and drawn the stand, but now I bought it at some amount. Then I'll come here and produce a certain part which will help some girls somewhere.
Another concern?
Maybe I can give this guy free advice. Because the main product here is cellulose. Huh? Why don't you think of producing this cellulose and selling it? It is easier. Because the other bit will be an uphill task. I've seen it, and maybe think about it. We have guys here from engineering and other areas. You can think of coming up with an extractor. That will be a very viable project and easily achievable. The other one, it will take a long route, and even the adaptability to take time. But because there are companies which are ready to adopt the product and they add value to it, I think it can work still. So think about that.
Okay, thank you for that advice. I can find that one and also keep on my project.
Yeah, thank you. That's a nice concept that you're having. But mine is somehow a follow-up of my colleague's opinion that I guess it being involving reproductive health, it will mean that you also have to have ways of how you're going to ascertain the sanitation standards of this this product if in case it's going to be accepted for use. So in your I guess the work plan, you have factored away of either disinfection, sterilizations as a means of assuring that this product can be used and it's acceptable.
Okay, so far I've consulted some of the university lecturers about it. Some have advised me on some 1 2 issues which I'm working on them.
Another concern? Since there's none, let's appreciate him. Next is Kinoti.
class from Karuma Technical Training Institute. Mine is to present for your project. The name, we are promoting agriculture through irrigation by use of highway surface collected water. Our problem statement in this case, or the problems that we want to address, the challenge of surface water on our roads here in Kenya and even abroad. The drainage in most of our roads is of course substandard, and it leads to flooding. And this flooding, it later leads to waterborne diseases like cholera and typhoid. This model also looks at addressing the draining challenge. Our draining challenge, when we talk of draining challenge, in our roads, maybe for those who are studying engineering here, there are different elevations for a road surface. There is that water that comes from a road pavement. And this water, we are going to provide means of collecting this water. Our model offers that solution. We need, after collecting our water, especially in those dry areas in Kenya, we have got highways. The water that drains from those highways down there goes to waste. And therefore, if this water is collected, it can be used either we can be able to use, after we collect this water, we can be able to use it either in irrigation, which will help us offer food security in Kenya, which is among our country's big four agenda. It will also help us in maybe cattle rearing, which will also enhance food security and also offer the draining challenges in our roads. Our prototype is available in our workshops back there in Karuma Technical Training Institute. We can request you to visit us there and see what we are doing. So our introduction, we talk of this water is collected by a pipe. Since the surface of the backment is waterproof, and then channeled to a storage dam. And it is now from this storage dam we can be able to use our water from. That is for this that we have been able to talk about here previously. There is the procedure. First of all, we prepare the bottom of our subgrade where pavement is to be laid. There is our prototype. Then we lay the pavement layers to the required elevations. We construct the bottom surface of the backment at intervals of 500 meters with two slopes, that is each 250 meters, meeting at a point, and at its edges we lay a barrier which we refer as curves. On these curves now, where the two slopes meet, we fix a collection pipe. Then we lay 2 layers of gravel ballast on the backment at 50% slope. Those ones are the slopes where we can be able to see our gravel. And then we provide the road furniture. The road furniture includes the road markings, road signs, and so on. Then we have, in fact, when we talk of competition, there are no those solutions in the market currently. But there is no, those other countries which are innovating the same project to provide the means of collection of highway surface water. The advantages of this project: environment is conserved, food security is enhanced, animal welfare practice is enhanced due to availability of water. When this water is purified and treated, it can be used for domestic purposes. The disadvantages, we have got only one disadvantage. Of course, the cost goes a little bit higher because now the drainages must be well kept in place for us to be able to collect this water. We can be able to sell our idea to these bodies which help or which are capable for, which are mandated in construction of highways or in roads in Kenya. We have Kenya National Highways Authority, that is for highways. Kenya Rural Roads Authority, that one is for rural roads. There is a mistake there. That other one is, of course, PURA, not double R, Kenya Urban Roads authority so that they can improve their designs to our designs here so that we are able to collect this water. The presenters for this project is Not Nicholas and Kalumas.
Let's appreciate him. We're inviting questions to Kinoti Nicholas. Any questions?
Unfortunately, I was not in when you are starting. Maybe you could take us to your first slide. Or just briefly say what is your problem you're solving and the solution you created.
The problem we are solving currently is about food security. You can realize that we are suffering a lot of poverty in Kenya and even the whole of East Africa. And then, for those small grants that we get, we are trying to see how we can be able to collect the water from the highway surfaces or road surfaces, which always goes to waste when it rains. We are urging the government or these bodies which are currently capable for providing designs of these roads to provide their designs which will offer a place for collection of this water by providing either dams and also means of collection. After collection of this water, we are saying that we can be able to use now this water for irrigation purposes, for also domestic use. After we purify this water, we can also be able to use this water for animal rearing. That is all it's about.
If I may ask you, let's assume that I come from Laikipia. To be specific, Laikipia University. That place, it rains a lot. Or let's say I come from Kisii Highlands, whereby rains are menace, like it can start raining from morning till evening. Will there be need to conserve that water? Because there are no shortages of water in those areas.
Okay, what I'm sure is that water has never been enough. Water has never been enough. Water has never been packaged enough. And there is nowhere where we don't have shortage of water. So I think it is advisable if we have these dams, maybe for community purposes and also for domestic purposes.
Another question is, so how much will your project, like let's say for a 10-kilometer road, how much do you expect to invest, and how much do you expect in return after like now the water has been collected?
Okay, because there are these parastatals which are capable for doing this work, ours is to sell the idea to them. Of course, if well financed, we can be able to start a company that is for road construction, of which we can be able to demonstrate on the ground what we are doing here in our project. And again, if well financed and we have our own company and we are able to have these funds in place, or if the government buys the ideas, then the problem of maybe drought will be solved.
Maybe you have answered part of it. However, let me go to the next question. Don't you think the dams will pose a danger of security, because people will capture somebody, kill them and throw them there, or the alcoholics, somebody goes, takes changa, staggers, as he's staggering home, he can fall to that dam. What about that?
Of course, currently the dams that are being constructed, we advise that will be fenced, so that now the access is for no, it's not for everyone who can be able to access the dam.
And my final question is, between drilling a borehole or a well and building a dam so that to collect rainwaters, which can take even 2 years to rain, which one is cheaper?
Okay, I think dams are cheaper in some places, because you will realize that in some places we have the water table is not very near, and therefore the cost of maybe drilling boreholes is a bit higher.
Thank you. Yes, my question would be, won't this your project make road construction expensive, given that you are proposing to build reservoirs on the sides of the roads, right? And then those reservoirs must be along the whole distance of the road. Since they are dangerous, you will need the rail guards also along. Won't that be expensive for our Kenyan economy?
According to the research we have made, the cost of roads just goes slightly higher with around about 5%, not very high. But in relation to the advantage that it will bring to us as a country, the advantage is bigger than the small amount.
Do you think we really need this surface water when the water is from rain? Do you really need it?
Of course we need it because after storing it, we can use it for future. Of course when rains disappear.
How much is that water that we just need that to incur that 5% cost?
It is too much, because if anyone have been to maybe a road when it is raining, I believe each and every one of us have been here. We always see that we have a lot of water which goes to waste, which just drains away. And then that is the water now we are providing the means for collection. It is too much water.
It's okay.
I think this idea is so prevalent in areas like Meru, where rains come once in a blue moon. True, and the northeastern part of Kenya, because their rains are scarce. However, in rain-infested areas like Laikipia, Burnt Forest in the Rift Valley, I think the dams will be overwhelmed. Another concern before we go to one of the staff members who is an innovator to present. Since there is no another question, let's applaud him. So I'm inviting Patrick Mudaria, and then Norbert will be our last presenter for the day.
Good afternoon, innovators. Yeah, my name is Patrick Mudaria. I'm from the School of Health Sciences here at Meru University of Science and Technology. And I'm here to share with you an innovative idea that my colleagues and I have come up with. This is an idea on digital pathology, and we intend to employ it in terms of teaching digital pathology. So my co-innovators, as you can see, is Professor Chaitanya Chuki, Dr. Ems Chege, myself, the Pathology Network, and the Aroa Cancer Center. Now, digital pathology is a fairly new field And if you just go back just a year ago, when the global pandemic hit the whole world, most of the learning institutions, not all, were closed. And this included institutions that have medical schools, institutions that train pathologists, institutions that train medical laboratory technicians, and this became quite a huge problem. However, there is a small percentage, very small percentage of medical schools that did not entirely close, those that had already embraced digital learning, as we mostly call it ODEL here at Meru University. That is open and distance learning. Now, those that had embraced digital learning were not affected as such, but most of the other institutions faced closure. Now, digital pathology is coming in so that we can deal with the aspect of delayed output of results. And by delayed output of results, I mean the time period between when a sample is taken from a patient and it is taken to the laboratory, it is analyzed, and the results are given to the patient. That is the output I'm referring to. And therefore, the usual processes take quite a period of time, and that delays the output. Quality assurance is always not a guarantee. We have heard of people talking about third opinion, seeking second opinion, third opinion from a doctor. I went to Dr. X, or I went to Clinic X, I was told that I could be having either hemophilia, probably, anemia, but let me seek opinion from another doctor, and or even a third one, and probably get to know who is more accurate, or who did they give me accurate data. So we have an issue with quality assurance when clients want to seek second, third, and fourth opinion. And like I've said, we have the challenges with interrupted learning. This interrupted learning could be either in form of, for example, the pandemic that forced us to close the colleges, but even at times when there are student unrests, campuses have to be closed. Now, in that case, then digital pathology is coming in this sense. Now, there is the digital aspect and there's the pathology aspects. That's why I'm saying that this incorporates the acquisition and the management of patient data from the time a sample is taken and the slide is analyzed under a microscope, and a digital image of that slide is taken and stored in a digital format. So that is what we call it digital pathology, such that a pathologist in America, a pathologist in Meru, a pathologist in Kisumu, within just a click of a button, can be able to share slides and compare results. I may have seen that a patient has anemia. My colleague here might have said, oh no, that's something totally different. And that is what we are trying to introduce here as digital pathology. So this would mean that the benefits will translate to increased turnaround time for results, right? Such that, the traditional way of doing things is that a consultant has taken, in this case, a pathologist has taken a patient sample, is obtained from a biopsy. It is sent to a lab, probably even as far as Nairobi. The patient is here in Meru, probably has a mass on his or her neck or somewhere, a growth, and they need to be confirmed whether it is cancerous, benign or not. So those have to go to results, to Nairobi, taken manually, transported back when the results are out. Now that is time wasted, and that could have repercussions in terms of a client's life. So this digital pathology is meant to at least reduce that turnaround time. And then there is the issue of uninterrupted training in institutions that have clinical pathology sessions and medical laboratory students. So whether they are in campus or off campus, as long as they have access to stable internet, they're able to access what has been, or the slides that have been placed there by the concerned lecturer. And definitely there's also exposure of cases. What do we mean by exposure of cases? There are some unique cases like mucormycosis. One could join a medical school, my colleague here knows that, and even complete without probably even having seen a case of a rare thing like mucormycosis, or even some other rare conditions. But if you have this network being in place, then it means that probably someone could have seen such a case, even in India, and shared it with a colleague here in Meru, not even in Kenya, here in Meru, and we're able to expose the students to that slides. The slides, they're able to see the formation of the cells, how the cells appear in case of such a unique case. And therefore, there's also the improved accuracy of diagnosis because of that aspect that are referred to as quality assurance. Usually, external quality assurance will mean that I have seen that probably diagnosis could be XY disorder. But what if I share the same slides with my fellow pathologist in Kisumu and my colleague probably in Mombasa or Kampala or Kigali, so that we have one common answer, all right? So that we not have someone taking time for it. So in that case, our business model is taking this format. We'll have the usual sample process, that is from sample collection, processing, reporting. But then, for purposes of learning, that is where now our unique innovative idea which we are trying to implement here, such that we will screen, or we try to screen the patient's information so that there is anonymity aspects, and then this information now is now interfaced with the university learning management system, such that now it is available to both learners and lecturers that are teaching in the respective topic. It will be in any topic in pathology or in hematology or any aspect. So once it is interfaced, then it is now available. And therefore, it being available to the full-time students of the university, then we intend to also offer the same to other universities, but on subscription basis. So they subscribe to this platform, their students have access to this platform, and therefore that can translate to some revenue generation. Now we have considered that we have a 3-point competitive advantage in the sense that we have partnership with Aroa Cancer Center. This is an operational clinic that actually is run and managed by pathologists that are in a network, not just in Kenya, but in the rest of Africa. So that being the case, it means that whatever slides that you're going to share with the students are that probably this is a probably hemophilic or leukemic, or even probably an atypical tuberculosis case, you are very sure that it is 99.9%, if not 100% the case. So that way we have an advantage compared to probably other cases. And therefore, also, you have an operational agreement with the pathology network. This is a network that is already in place. It is already in place. And therefore, we are going to also have access to cases that have been diagnosed from all over Africa, if not globally, by other pathologists that have subscribed to the pathology network. And therefore, our students will very much benefit from that because those are cases that are from world over. And thirdly, is that we have been able to acquire a digital slide scanner. A digital slide scanner is a microscope. Let's start from there. It is a microscope that has the ability to take a digital image. So very many digital images of that slide that the sample has been put on. So the images, once they're taken, they're now stored in a digital format. And therefore, with those 3 points, I think we feel that we would be, above probably what other people are thinking of, or even what other probably institutions have been offering as online teaching in terms of either video lectures or audio lectures. So then, in this case, is that what we have been seeking is probably just a small grant, a seed grant, that will facilitate operationalizing our idea, such that probably we need to have personnel in the lab, and also having accessibility to stable LAN internet, because once the images are taken by a digital slide scanner, they need to be shared through that same microscope. That microscope has to have access to the internet for it to be able to share the same images and the same cases to whoever that you want to have access with. And without much ado, I wish to stop there. And that is an image of the left-hand side. We have slides, microscope slides, before they are under a microscope. That is how they look, a thick film, a thin film, and a number of slides that are there. And this innovation is for the fact that you do not have, you can imagine, ever since you were born, you have been having probably a relative going for malaria testing or TB testing, and the slides are somewhere in a clinic somewhere. What if they are used for teaching purposes? Otherwise, thank you so much.
It's appreciated. Questions to the presenter?
Maybe just a compliment or an addition. Thank you, Patrick, for your nice and well thought presentation. Maybe the only input I would like him to add in the project is that with the outbreak of COVID-19, it is not only a solution for teaching, it can also be a solution for the clinicians and the physician in the field. Instead of us carrying those hard copy reports from the clinical sites, I'm telling you, most of the government hospitals have embraced technology. They have computer desktop in the consultation rooms, the clinicians, the nurses, the doctors. These days, there is no carrying of hard copy. Actually, it's just print out of report you the patient request. So I think one of the solutions we're giving it will cut cost on paper, it will cut cost on, also it will reduce disease spreading, because every time you carry this paper, you carry the material, it transmits, it carries some microbes. So I think under your justification and benefits, we should come out clearly on that.
Another concern?
So you have the prototype for this particular digital pathology?
Yes, we have a prototype in the sense that through those partners of ours, the pathology network specific, they have a similar business model. But you see now theirs is purely for clinical practice, not really for teaching. So we are able to share as partners, as clinicians and pathologists, they're able to share information about a certain patient before a confirmatory diagnosis and diagnostic report is written. So it is there and it is operating, we are able to interact with the colleagues from all over.
Another concern? Let's appreciate Patrick. Our next presenter is Norbert from Karumo.
Good afternoon, innovators.
Good afternoon.
Norbert, I'm food technologist. We came up with the title our project, use of sweet potatoes as one of the indigenous foods we have been using since many years ago, and still it's a stable food. It's only that it has not been widely used. Our problem is deficiency of some of these vital nutrients in the snacks you take or any other bite of a cake when you want to quench your hunger. Because all of us know every other moment we are called for a social event, is the delight of a cake or a corporate event. And now we want to make sure this cake comes to our table right from the morning and goes to every other time of the day. Having in mind, majority of the cakes we are having around our shops have a lot of sugar, and we all know sugars are not, the manufactured sugars are not that friendly for our bodies, starting from our mouths. No one of us would want to take a lot of cake in the morning and then you go out. You all know what will happen from the mouth and not go down to the system of your body because it is not good. They can't manufacture sugar, and we came up with what? With the sugar from our sweet potatoes. Because the sugar in it is friendly to our bodies and it will not lead probably to some of the problems we are having on top of the COVID-19. Still people are having diabetes and other problems related to the foods we take every other day. We wanted to object to bring these locally available materials. Cassava is grown to many rich agricultural areas, including here we are. It's also grown in other areas. And if we compare price for a sweet potato compared to wheat flour, you find with 50 Kenya shillings, you can buy some good amount. And then not only preparing it but by boiling or steaming at your household level. When you are out with your family, including the children and probably the elderly, our cake will be suitable for everyone. You can buy it outside if we get the financing to bring it to enterprise or start a running business. The procedure, we did not want to move out from what is known because still our food laboratories are working on how to incorporate everything to the procedure of making this sweet potato cake. We are taking the steps, the normal steps also have been in the kitchens, in the household, because cooking is as old as man started to eat cooked food from raw food. The other ingredients we have not tempered with them because we are majorly reducing the amount of manufactured sugar we put in our cakes. And the procedure, because now our sweet potato is, we are doing it, we buy or we partner with those, there are people who have started our business, people who are partners, who manufacture the flour, and this flour is the one we are going to use. And because we are seeing sweet potato is all food, which has very good fiber, vitamin A, because we have two types for now, which are common in our Kenyan market, the white and the yellowish one. We want also to make sure we use everything, including the peels. When we peel, we dry. We can either use those who are doing the manufacturing, we advise them to do the solar dry or sun dry. There are places where there is a lot of sun, so that even the peelings of these sweet potatoes can be made to flour that can be added to porridges and other, because we understand when you peel it with some content, it has some sugars and also some fiber. It can be added to porridges and other drinks people take to avoid a situation whereby every other drink you are preparing for your family, you have to use the normal sugar from the shops. That is the complete of the baking. And then we have competitors, are the normal ones, like those who are not using indigenous, local available ingredients to manufacture food, including the very sugary cakes we have in the market. We also have the breads, those who like to take the white bread and then other bread in the morning. We would want this sweet potato cake to be the morning item for you to drink with that cup of coffee or tea, and you avoid the breads and so on. Then because we want ours to be the brand in the market, we think if we do proper marketing, the normal cakes usage will subside, and then people will embrace cakes that are nutritive than the normal ones, and also to ensure it reaches majority of the places, because we all know we have a problem in the distribution of our foods, because we say we have rich and agricultural areas and the food is being produced, but a problem comes in terms of distribution and how it reaches places where it is scarce. Our food labs are working on how to make sure our cake takes longer after being baked and packaged, because normally we use the spirits, that's alcohol spirits, to preserve our normal cakes. These are advantages of how our cake will make sure we utilize these resources within our local farms. These are about the body, the way it does, immunity, brain function, because of vitamins in fish serving. The ones are found in the flour and the normal cakes we are getting today in the market. If our idea is taken up at the market, which we are pretty sure will influence the market, our cake or our cakes using sweet potatoes will tap the market, and then will help us to generate some income that can help us as a Karumo community to come up with other projects that can benefit our country and also other places. That marks the end.
Let's appreciate him. And I invite questions to the presenter. Yes, there's a question from Patrick, Doctor.
Thank you for that wonderful presentation. Mine is just an observation that probably as a food scientist, you know that it is a requirement that all foods that are out there in the community require to be labeled and the proper batches included, isn't it? So for purposes of labeling, usually it is again encouraged. Also, it's a legal requirement that when you say it has anti-cancer properties and it has vitamins, probably now as you start producing it in the market, you need to name which probably just one or two of those vitamins, and probably the anti-carcinogenic properties that you're saying that it has, isn't it? Yes, so that usually it is advised that way, so that the consumers have the right to choose and have the right to information. You see, these days people will say, oh, they want food that has gluten-free, basically that is not gluten, one that does not have a preservative or an additional maybe coloring or something. Just that information is important when you come to production, that is. Thank you.
Do you want to respond to that first?
Yeah. Thank you for that input. Yeah, we'll ensure the content that has been given is part of our project.
Thank you. It's very exciting actually to hear about a cake made from the
sweet potato.
A sweet potato. I was excited also some 2 years ago when there was an industry which came in our village to make brands enhanced with sweet potato. So I hope you keep this excitement. The only challenge I have with these new innovations is that I'm worried about the food chain. As my colleague, as medical people, we are so worried about what we eat. Every time we take something near our mouth, we think about it. Unlike other people, they just eat. Since which we imagine, you check here and see how it is packaged. You don't check. We check the expiry date and many other things. So, how sure are you? Okay, where is the source of your sweet potatoes? Are they not genetically modified? Or how will you make sure that what you will be using is not GMO? Because we have a problem. We don't know what is what in our farms. Our food chain has been contaminated seriously. So, in your model for sustainability, for ensuring that your product is of good quality, then we also need to know the source of your raw materials.
Thank you for that. Having some experience or some years experience in the food industry, and also we say when you are living in a community, you are not isolated. When we embark on a large scale, we will ensure we observe what we call hazard analysis critical control point to ensure all the stages of our raw materials. For example, we may not have a 100% control on what the farmer is doing every other time, but we will ensure we partner with government agencies, and then we get the right, if it is chemicals like pesticide and also the fertilizers, we get guidance on what is right to be used, and then we'll be in a position to select which places within our country or which places within our locals, because we want to get the original sweet potatoes, not the ones that are being done today, maybe to get that mass production of them from the farm.
I have a question. I heard you say that there is sweet potato flour in the market. Is it there? What is it used for right now?
Thank you for that question. Now you will find, because majority of us in the society, we have got used to the items that have been, food that have been manufactured from when we are growing, like bread and so on. You will find few companies are coming up with such ideas, and they are manufacturing these flours, not only the one for sweet potatoes. Like here in Meru, you can get it from one shop or company, Nubian. You will also see it in the supermarkets. To embrace usage of this food is not that much. As I've done some research locally, many people are still using the normal foods. One will tell you, unless I take a slice of bread, and if you tell the person to take probably the one, we have not examined the brown bread we see, to what content of the fiber, to what content of the other nutrients. But we taking up this project, we want to see it such that we promote. So that people not only take bread, but can buy such a flour and use it at household level.
My other question is, so to ensure quality control, will you use the bought flour, or you intend that in the long run you will be the one who will be grinding your own sweet potatoes that you will have bought from specific farmers because they follow the specific guidelines that you want, and then use it to prepare cakes?
Thank you for that second question. Before we engage in full-fledged production of the same of the product in using sweet potatoes flour, we would want to engage with others so that we sign it on numbers. Somebody will do it for us because we may not be so much engaged in but we get specifications from the authorities so that we guide the whoever will be doing. We can partner with people who are out because not only us, other people will use indigenous ingredients will remain our partners, not our competitors. So that such a people can, those who are doing the manufacturing can also sell to others who are willing to embrace such.
My final question is, I know guys who are fully indigenous, like even their cakes, they taste like the uneven bread in the Bible. What's new in your cake?
What is new in my cake? Thank you. What is new in this cake project is, one, is a cake for all seasons. The taste is different from the normal cakes. And probably our signature recipe will taste different from what other people who may be expressing the same ingredients are producing and what is the taste of their product.
Do you have a sample of your cake? I wish to taste it. Or is it still an idea?
Partly an idea, quarter is an idea, 3/4 is actualized.
I'm thinking about the length of time it takes to plant sweet potato until it matures. How long is it?
Yeah, from the agriculturist, it can 6 months average.
So what would make me choose your cake and not the other ones that you use for wheat in the shops? I think that's the question he was asking. What is this new thing in your cake that makes it totally different from any other cake that I would just choose your cake and not the other cake?
One, if we have all taken cakes, normal cakes, it serves as a snack. But this one will have richness in terms of fiber, and the fiber we know what it means. It will secure your systems. It will not be like a snack anymore. It will be like food now. That's the uniqueness of it. It can you take longer when you are free from hunger.
Cost-wise?
Cost-wise, I can say it will be accommodating because not only are we doing on sweet potato, we have analyzed others, but we pick sweet potato because of the cost effectiveness. If you can remember very well, I said having 50 Kenya shillings, you can buy almost from the local farm or from the local market, almost 2 kgs of sweet potatoes. And those can make several 2 or 3 blocks to market. So cost-wise, I tend to think it is effective or pocket-friendly, if I can say so.
How about the shelf life? How long does it take to expire? Because I'm wondering, are you going to be buying flour from Nubian, the one you mentioned, then you make your cake? Or are you going to be buying sweet potatoes from farmers, then you dry, then you make flour, then you cook the cake?
Thank you for that. Now, from other innovators, we had when you dry some liters, some water like this, it takes longer time. When we are starting we are actualizing the production of the same, we will embrace doing some processing of getting the flour or the ingredients from this sweet potato from the selected certified farmers. That would be one way. Because the moment we dry from the peels, the slices of raw cubes of cakes, and then we partner with somebody who does it hygienically to mill, that one will be. But now, as I said, on the part of now having baked this cake, you know cake, for us, for somebody to say this is a cake, it has to have some moisture content. And we know how bacteria work. We are working on how to preserve now a baked cake using sweet potatoes, because we know normal cake can take more than even 3 months when you refrigerate it. We are working on the preservation of this baked, but not on the ingredients, because we know that once it's dry, we can store dry ingredients and use in the future.
I have a question. I'm interested in this particular cake because I'm not a cake consumer presently. Because one, it's baked sugar and I'm not taking sugar. Number two, it has a baking powder and I'm not consuming the same. So I'm interested in this. So I'm a consumer of a sweet potato. Please convince me to use your product because I'm interested in it. I'm consuming the sweet potato the way it is. I don't want to bake it, but now being that you brought an idea of baking it and coming out with a cake, please may I just have a conviction to consume your product, because I'm not consuming the baking powder and sugar, but this one it's like an alternative. So basically you've just brought a new baking flour, but everything is the same, because I can still see in your procedure we still have a baking powder. So to me it will not be a benefit, because I consume the product, the URO product, the way it is. I consume the sweet potato the way it is. But now I might be in need of consuming it in different form. That's why I was interested particularly in this.
Thank you for that challenge. Now, I can say that composition of our client is just a small scale. We have not catered to that because ours, we have not excluded the baking powder. Maybe in future developments, we will go further to see how we can produce cakes without baking powder. Maybe people who do not take such chemicals.
Maybe in your hazard analysis critical control point and the prerequisite programs, you can come up with a more organic substitute for baking powder. I think that's what he's trying to tell you, that this is not purely
natural,
organic or natural. Yeah, because it has baking powder, it has whatnot, but in your hacks programs, prerequisite programs, you can qualify and something that is very organic. So in that case, something that will assist in the baking and it is relatively organic, you can qualify it at that point.
I have a concern. You say that you have actualized 3/4. A quarter is what you have not actualized, right?
Pardon?
You say that you have actualized 3/4 of your innovation and you have not actualized a quarter of it. What have you actualized and what have you not actualized?
Thank you for that. Let me start with that. What we have actualized. We have actualized practically. We are producing sweet potato cakes without the normal sugar you buy from the shop. Totally what we have not done. We have not finished the issue of preservation. What types of preservation or preservatives are we going to use for our baked cakes to have longer shelf life? And then the issues of maybe how we need to reach many, or where we reach to promote our idea or to the members. That is the business model.
Thank you.
Just one more. The present millers which you have today, maybe they are not milling the potatoes. How will you mill the potatoes to make a flour?
Thank you. Now,
Or,
it's okay.
it's okay, you've gotten the question.
Yeah. I want to say, because I say that we are in a society and there are some linkages. Currently, we have millers who are doing almost every item you bring to them as long as it's doable. There are millers who are doing fish, that is the omena, and such. They incorporate any other item as long as it will become cost effective to them or it has some value. So for our starting, we are partnering with a certified, all those who can meet our regulations or our standards.
Another concern? Since there is no other concern, let's appreciate Norbert.
Thank you, Norbert, and thank you for our guests. We want to break for lunch, and I want first the guests to be served. Then our staff and presenters will follow next. So we'll break for lunch, then we come back for the next direction. Okay? And thank you very much, Karumo Tech people. You're doing a good job. Please, let's clap for them. Thank you for finding time to join us today. So we are going to break for lunch, and then we will continue. So please, our guests, you can follow me. I'll show you where you can have your lunch from Karumo.
We want to enable, create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic hardware skills. So when they visit the schools, they train the teachers, but if there is any networking or hardware problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through Senate Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long-forgotten learners who have physical disabilities.
Shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to access secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, again the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project but something that is big enough that can be adopted in any part of the country.
We want to create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic hardware skills. So when they visit the schools, they train the teachers, but if there is any networking or hardware problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through Senate Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long-forgotten learners who have physical disabilities.
Ni shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to access secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, again the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project but something that is big enough that can be adopted in any part of the country.
We want to enable, create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently, or people living with
Our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic handwear skills. So when they visit the schools, they train the teachers, but if there is any networking or hardware problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having then the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through Senate Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long-forgotten learners who have physical disabilities.
Ni shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to access secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, again, the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project, but something that is big enough that can be adopted in any part of the country.
We want to enable, create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start
we want to enable, create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic hardware skills. So when they visit the schools, they train the teachers, but if there is any networking or hardware problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through CNET Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long-forgotten learners who have physical disabilities.
Shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to access secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, Again, the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project, but something that is big enough that can be adopted in any part of the country.
We want to enable, create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic handwear skills. So when they visit the schools, they train the teachers, but if there is any networking or handwear problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through CNET Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long-forgotten learners who have physical disabilities.
Ni shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to access secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, again, the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project, but something that is big enough that can be adopted in any part of the country.
We want to enable, create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic handwear skills. So when they visit the schools, they train the teachers, but if there is any networking or handwear problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having then the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through CNET Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long-forgotten learners who have physical disabilities.
Shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to access secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, again, the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project, but something that is big enough that can be adopted in any part of the country.
We want to create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic hardware skills. So when they visit the schools, they train the teachers, but if there is any networking or hardware problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through Senate Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long-forgotten learners who have physical disabilities.
Shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to access secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, again, the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project, but something that is big enough that can be adopted in any part of the country.
We want to create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic hardware skills. So when they visit the schools, they train the teachers, But if there is any networking or hardware problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having then the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through Senate Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long-forgotten learners who have physical disabilities.
Ni shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, again the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project but something that is big enough that can be adopted in any part of the country.
We want to create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society, and we want to show the world that people enabled differently or people living with physical disability can achieve it. And through CNET, we will reach them.
When we started the research, our plan was to start by training trainers of trainers. So we identified our students from Meru University of Science and Technology, and Kenya Methodist University, and Murang'a University. And these students, we have trained them, and they are quite competent now. And so the intention of training these students was so that they can help us to train the teachers in the selected schools. We have also trained them on how to fabricate some of our technologies so that we don't have to import all the time, and basic hardware skills. So when they visit the schools, they train the teachers, but if there is any networking or hardware problem, anything malfunctioning, then they also correct the problems, they troubleshoot. And then from the TOTs now have helped us to train the teachers. And so with the teachers having then the skills on our technologies, they can now train the students, the pupils. And that has been done because we are not trained to teach pupils at that level. So you see, we needed that link from the TOTs to the teachers and then to the pupils. And that has been done in these schools.
Through CNET Academy, we actually appreciate this good initiative and innovation. I hope it is going to reach the long forgotten learners who have physical disabilities.
Ni shukrani sana kwa wale wametuletea hizi computers na watoto wamezifurahia sana.
They're able to access secondary schools and they're able to acquire technical skills that will empower them economically and socially. So that once they finish school, they're able either to equip themselves, to employ themselves, or to be employed by anyone, the government or any other person.
We expect that when the school comes back to normalcy, again the students that we have trained, they will assist us in training other students in order so that we make CNET not really being a project but something that is big enough that can be adopted in any part of the country.
We want to enable, create an environment for the learners with special need to be able to learn with ease, access education opportunities, business opportunities, and live a dignified life. How do we do that? We first give knowledge and skills and work on the perception and the attitude of the society about persons living with challenges related to their physical frame. And in these specific terms, we are talking about learners, children, who are our subject.
And we want to empower them. We want to bring them out from the hidden places in the society.
Our team of students in the area of forensics, they will do that presentation, and I was also saying that we also have a presentation from one of our staff, Dr. Ryungu, who is specialized in sanitation. She's been in this for long, and she'll just do a presentation to us where as innovators, we will learn from her the strides she has made in that area. Also, we are expecting one of us also in the countrywide innovators hub to join us and share his story on innovation, just to inspire us, especially those who are innovators and you're feeling like you want to get into the world of innovation. Tomorrow will be our last day, and we expect several guests to join us virtually and also physically. So we anticipate to host several guests, and we expect you also to be with us tomorrow. So plan to be here tomorrow. If the venue is full, we can occupy the upper floors and join virtually, because you know the times that we are living in. And because I can see our speaker is taking time to log in, maybe we could listen to the student presentations first. Right? Yes. You ready? Yes. You have a problem? So tomorrow will be our last day. We will be here this Monday, and we are glad that we've been able to follow through, and today we are happy that we got several who are testing for graduates who are members. They really showed us very nice presentation, and we are really glad that it was famous. In the morning we had a session with the Deputy Vice Chancellor from Zitech University, Dr. Alice Ndukuru. And she shared a lot in the area of innovation, which I believe all of us might have learned one thing or another in that area. So Seth and Eugene, are you ready? Where's the flash disk? I think we should load it here. It's up. Just give us a PowerPoint video.
Oh, okay. Because we had a demo.
If there's any demonstration, we'll just disconnect from this and connect to the machine. I can see service coming in. Let me just update it. If it's ready, can take it up, then listen to you guys. Isaac.
Ziko sawa? Hello, Savio.
Yes, Daktari.
How are you?
I'm very good. Just joined in.
Okay.
Yes.
You're ready?
I'm always ready.
Yes?
I'm always ready.
Sasa.
You can hear me well?
Yes, you're loud and clear.
Okay.
Are you able to turn on your camera?
Yeah, but I don't have the right. Okay. Oh, sorry.
Yeah, unakaa innovator.
Is it okay ama niende hapa kwa gym training hapa?
Maybe now.
Let me go up.
Okay.
Sasa niende hapa. Sorry, we had a game, so nilikuwa kwa uwanja.
It's fine. That's better. Yeah. Okay, so I hope you're able to see us from that end.
I can see you. I can see media team.
All right.
Dr. Amos, wewe uko mteja. You don't have the light.
No, it's
The camera one.
No, it's okay. You'll be able to see the rest as we progress. So we are happy to have you, and I want to bring you on board so that you can share your innovation journey with the innovators here. And I know the media team will be able to show the presenters as we continue. So once you're ready, just let me know so that I can give you the opportunity to speak to the innovators. Savio, can you hear me? Hello?
I can hear you clearly.
Okay.
I can hear you clearly.
So then, I'm waiting for you to settle. All right. So I want to give you some few minutes just to speak to the innovators. You ready? Unmute.
Yeah, I'm ready now.
Good. So you can introduce yourself and take it off. Sorry.
Thank you very much, Daktari, and it's a pleasure being here. So my name is Savio Amboko. I'm a software engineer. I guess now doing over 10 years as a software developer. I'm also the founder of Mount Kenya Hub, which basically is an innovation hub located in Mount Kenya region, in Nyeri and Kiambu. I am the Secretary General of Association of Countrywide Hubs, which is an association of innovation hubs located in the county regions. I guess now we are 30, and I'm also a consultant with the UN in matters technology. So it's a pleasure being here, and my journey is an inspiration to many as per now. And I like to congratulate Dr. Amos for this, because I remember when I was in the university, I finished at Kenya Methodist University. During the third year and fourth year, we used to do annual computer science competitions. And it's the same thing that Meru University is doing right now, which is one thing that molded me to be who I am. Because oftenly, as developers, in your own ecosystem, you always think that you are the best. You are the best developer, since you are the best in your class and in the university. But again, if you don't get other challenges, you get to relax. So I remember when I was in the university, we didn't have the Android phones, which means the probability of me learning how to develop Android phones was zero. But what I can say right now, I'm a software engineer and and I also do Android development. So the lessons that I want to say is the challenges and the competition, as like what we are having here, is one thing that is building the career of tomorrow. So, and what I want to say is, when I was in the university, we used to start developing programs, systems and softwares even before you analyze it. So you'd come and you think that you want to develop, let's say, a school management system. But even before you design it, you start writing the code, which is a big mistake. So what I would like to encourage people here today, even before you start writing the first code, you need to design it. You need to see even the money. Yeah, you need to see you need to see where the client is coming in, how you're getting money, even before you start writing that simple code. So and that's where we come in by doing the design thinking. Yeah, so whereby you design who is your customer, how do you want the system to do, who is your competitor, how are they, what is their edge. Yeah, so there's a lot of things being an innovator. And when I mean innovations, I don't mean ICT. People confuse being a techie and being an innovator. So even somebody who is doing, let's say, vertical gardening is also an innovator. But today what I want to say is the innovation journey is very harsh. When I finished my university, I was one of the best students, I remember, technically. Yeah. But so when I left my university, I thought that I'll get a job out there very easily. But I tell you, I tarmacked for more than a year. I would even go to some companies and tell them that I can even do the job for free. But they don't even want that. Yeah, they don't want to hire you. So, and that is the perspective of people who, when you're in university, you think you're very good. But again, you need to go out there and see what other people are doing. And I remember the first job I received was in one of the banks in Kenya, I won't mention it. And what they were looking at, they were saying they were looking for software engineers to develop Android, to develop mobile apps. Then it was about the catchlight system, the PSV system, yeah, ile ya kulipisha kwa gari. And the guy who came to, a guy came and told me, "Sabi wewe najua wewe ni developer mzuri. I want you to come, niku connect na bank you ufanye." And you remember, in my university, I didn't do Android development. Yeah, yetu ilikuwa ile web applications na hizi vitu kidogo kidogo. And so when I went to the bank, the first day we were going to a meeting to City Shuttle, which is a circle in Nairobi. And wamekaa hapo wanasema, now we have hired the experts. They are going to develop this solution in a record time. Yet, mimi hata sijaiona hiyo kitu yenye wanafanya hapo. But that's when I learned that all these things that you are learning here, you can even run on yourself. Because we used to learn at night, you study and you implement. You study and implement. The good thing with that is you don't have anywhere to refer. So you come up with your original, and you also get to learn a lot of things. We keep saying that a banker will never come up with the very good innovations in terms in the banking sector. Reason being, him or her amezoea mtu anakuja gets a ticket, for example, na anaonyeshwa ni wapi ataenda. So for him or her, that's normal. But now, we as innovators, that's where we come in. We are curious. We get to see, like for example, the people who came up with the ticketing system. Instead of somebody going to the bank, queuing, and then you reach there, then you are told, actually, ulikuwa unafaa kuona ule mtu mwingine. I'll tell you that for free. It's not those guys who came up with those ideas. It's we innovators who are here. So what I want to encourage you today is innovation life is very, it's very demanding. I remember my mother used to tell me, unaishia tu kwa nyumba wewe, ni nini unafanyanga? And we as innovators and mainly developers, you get to stay indoors for long, lakini hakuna mtu anaona. Si kama mtu mwenye analima unaona yenyewe, huyu amelima kutoka pale hadi hapa. We innovators today, we keep implementing and it's failing. But now, you should not give up. So long as you have designed and you see there is a business, so that you don't need to come up with solutions that do not have okay, it's basically, we say you come up with solutions or innovations that have no problem. Yeah. And another thing that I want to talk about is, I remember when we were in the university, we used to develop a lot of systems. But now, those systems cannot be businesses. But ukitembea huko, like for example, your girlfriend, sijui nani, wanaona wewe ni mkali sana. Yet, because of the innovation in umetengeneza, but again, that innovation will never be a business. So, you need to come up with solutions that are solving some problems. Isikuwe wewe, you are always popular. Unaona ule jamaa mwenye alitengeneza drone, huyu ndio ule kijana alitengeneza drone. But yet again, is it a business really? It will just be a fantasy. We call them fantasies. Yeah. So when you are looking to build solutions, even before you start developing, even before you start spending money, yeah, make sure that that solution has a problem, and you can even see where the money is coming in. If it's not a social impact innovation. So I don't want to speak much, but the innovation journey is very, it's very harsh. But again, not everybody can be an innovator. But I can see a lot of people there. You are the future of tomorrow. Just make sure that what you are building has a problem, and what you are building is something that is impacting the community. I remember we keep saying, if you want to be a very good innovator, or if you want to have a very good idea, make sure that that idea inagusa either the community, one, two, either people who are, sitaki kusema wasichana, it's because they invest their time, yeah, they take risk. And when we are here in Kenya, Kenya is one of the best countries to innovate because we love trying something new, yeah. It's different from other countries. They fear trying something new. So, Daktari, I will spend a lot of time. I know later on we'll meet to discuss things like the business canvas, yeah, the process of ideation, yeah, and finally, if you want to be an innovator, you also need to look at who is your teammate. I know guys there, you are going to come up with, you are looking for teams. Do not look for your friend. This is because if somebody is not adding value to your company, even if it's your mother, your father, or anything, do not involve them to be in your team because they'll just be wasting time, yet they are part of you. And also, avoid giving a lot of shares when you're starting. That's so that when you start growing on, you have something to give out. So, Daktari, I won't take a lot of time. Maybe next time we'll discuss more.
Thank you so much, Savio. You can clap for him. And thank you so much for giving us a slice of your time. I know you're in the field, but you could spare some time to come and speak to our innovators. We are really grateful, and we hope to have more engaging time when you come over to Meru physically. Thank you very much, Savio, and enjoy the rest of your day.
Thank you, sir.
Thank you. Okay. All right, so that is Savio Ambogo, one of influential guys in the innovation sector that has done a lot in the field of innovation. Ken, what's up?
Yeah, I'm well.
Okay. So I want to bring also Kenneth Nji here from Dedan Kimathi University to give us some his remarks before we progress. Karibu.
Thank you. Nataka niketi hapa. Eh? As a small.
Yeah, you can stand with the cameras will follow.
Okay. So.
Au mumuulize maswali.
So, how are you? We need some energy. Hi, how are you? Okay, thank you. So my name is Kenneth Nji here. I'm head of innovation at Dedan Kimathi University. I've been here a number of times. The last time was in 2017. We were trying to start something called the Google Developers Group. I don't know how many were here in 2017. I think most of them have graduated. I'm a hackathon facilitator. I facilitate hackathons in this country. And I know a number of people, like I have a friend there, two friends there. I've seen them, and most of the guys who graduated, is it this year, were my friends. So they came from Meru University, we've met at Konza, they come to Dedan Kimathi for the hackathons. So a hackathon is a 48 hours tech marathon. We start on Friday, no sleeping, we compete till Sunday in the evening. That lady is very nice. She can tell you the stories about that. Actually, she comes with her team, and they try and win. So I'm happy to see you again here. Thank you, Dr. Amos, for inviting me here to share what I have with these amazing people. So I'll say a few things about innovation. Then I'll share something that I feel that people need to know when they are starting innovation. I'll just do maximum of 10 minutes, but I hope I'll leave an impact in your lives as you start this journey, which is something very interesting. Cindy, so I'll expect so many questions from you. I'll be here maybe today and tomorrow, so you can also interact with me and ask me questions around innovation. So I've been in innovation since the year 2012. So by then I was in campus. We were 4 guys in a hostel. So it was room number 48 in our hostel. Then I was taking actuarial science in the university. Then we had one guy who was taking computer science. Then the other 3 were taking actuarial science. So this guy told us, I'm developing something, but we need to build it and share it with the world. But for this, we need to build a business. So the 3 of us, in actuarial science, we are talking about mathematics, a lot of insurance. We didn't know much about what they were building. So we told him that we can try and see how it becomes a business. So that was the first time I interacted with something that would come to be a startup. I didn't know where it was going. That was the first time. So in December that year, that is 22nd and 23rd, before that. So that was when he brought the idea was around September, when we just came back from a long holidays. Then in September, that's when the idea came in. In October, we started a very big club in the university. We called it the Computer Society of Kimathi. Then it became a big thing in the university. Actually, in 2012, in 2013, we were given the certificate of the biggest club in the university. We were bigger than the CU. We got a bigger following than the CU. Can you imagine that? So that's where we saw we have a movement, and we started a series of hackathons. And that's when the first team from Meru University, that was in 2014. That's when we got the first team from Meru University. So we had started attracting we were attracting teams from other universities joining our hackathons. So we were then competing with JKUAT. They had the JKUAT Tech Expo. So if you were around at that time, if you remember. So in 2014, I thought, what about we build software for the county government of Meru? I did a very big event called the Meru Civic Hack. Then the Vice Chancellor said, oh man, you can't go anywhere. So that's how I started my innovation lab. So from 2015, I started the D-Hub. That's the Data and Mark Innovation Hub. I've been working there until today. So, about startups, about innovations. So when you're innovating, you are trying to change how people have been doing things. Let's go back to when we were in campus. I know most of you are very young. So that's when we didn't have, what Samuel said, we did not have these touch things. We had phones, but they were the feature phones. At least ungesikia yenye naimba wimbo, unajua mtu kwao si hawayuko hivi hivi. So we were competing na memory cards. We were ukishare wimbo, and Bluetooth was something yenye mtu anasikia unaweza tuma kitu hapa na hakuna kitu hapa katikati na iende hapo. So bado ilikuwa bado ina excite. There were these apps to go and so what am I trying to go to? There was need for communication between one person to another. And this is a point that I'll be bringing in a few. Innovation is changing how people are living. We used to text, a lot of text. To quote Noziwa, 200 SMS, I think, yes. So we used to buy these messages, and then things happened. WhatsApp came. No one bought those messages again. It's the same thing, you're texting here, but you come here, it's easier because you can also share a photo. You see, that's distraction, and that's what innovation is all about. That was just a simple example. You need to bring something that will change how people have been living and make their life easier. Are we together? Hello? Yes. Tuko sawa? I hope na make point. So I want to share something that you should look at when you're looking at a problem to innovate about. Hiyo tu ndio kitu yenye nitaongelea. Then I'll be seated. Because this is something that's very interesting, and I think sharing it would be very good. Si ati sijui ni venye najikumbusha. Naangalia tu. I'll be able to explain. So the first thing that we look at is a problem that is popular. So if you want to know, happen to another thing. Popular. Look for a problem that has so many people. So many people want to do this. So this problem exists among so many people. So that problem becomes very sweet for you in terms of the value that it will bring back to you when you start earning from it. So the other thing is a problem that is growing. I don't know how this place was, but if you look back like 5 years ago, the university was still here, but I don't think the means of transport was as efficient as is it now. Is it? Yeah. Because maybe you had to pay like 200 to come here. You didn't have somewhere you can get a matatu to come here. Today I've found an app. You see, these things grow with the growing population. You see, the university is growing, and you know the university will be growing. So there are problems that around this university that will be growing too. There is a place here, I don't know the name of that center. The last time I was here, I hope what you do, and I don't know how much you've seen the change. Yeah? As the problems grow, here the developments grow. So the problems that are growing are very sweet for investment and are very sweet for the innovator because of the return that comes with it. Tuko pamoja? Ina make sense? Na it make sense mimi naambia marafiki zangu because innovators are my friend, unasimumu na niambia hili jamii sana. So, the other thing that makes a problem very nice for you to invest or to innovate around, it is very urgent. You see, hapa kukakuwa tumetoka hivi tuende maybe Meru town bila tujabeba sweater. Mvua inyeshe ama the weather change. Hivyo mbio mbio. Sisi wote tutakuwa tukiangalia nani anauza sweater cheap around hapa. Si ndio? Those problems that are urgent, inaitwa kwa you stepping on a nail test. Unaona ukienda ukanyage kitu kama msumari kwenye unatoa mkuu ndio. Such kind of urgency ndio tunataka problems zenye tukue nazo zikue. Okay? The other thing is expensive to solve. A problem that someone is willing to pay for. People, Savi was trying to say something. There are people who come up with solution in search of a problem. You just build something, but you don't know what it's solving, but you want it to solve something in the future. It's okay for fun, but if you want value, and that is what innovation is all about, then you need to get a problem that someone is willing to pay for. My friend, so unaweza sahi unaweza lipia university ya space ukage soon. What if we had the university in space? Will you pay for it? Then the other thing, problems that are mandatory. Things that, like communication, you must communicate. So people will be willing to pay for that. And the last one is problems that are frequent. So I've just said this because as you innovate, people will be willing to come to you, give you investment. But the investors will look at these things. How is your problem structured? Does it have all these features? Because when anyone is investing, when they want to be a stakeholder in your business, they are investing their money because they are interested with a positive outcome. And a positive outcome is affected by the structure of the project. So, and again, I'm done. Questions?
Yeah, thank you. I'm Lalai Samuel.
Adi?
I'm Lalai Samuel Tongai.
Yes.
You have said a very nice point.
Yes.
Of which I do get various questions from the students.
Yes.
That yes, I'm studying this course, but where am I heading to? And who will employ me?
Yeah.
And where am I, will I get a job And they have started with it this week, very well.
Yeah.
For now, you have said that you are in the Kimali hub.
Yeah.
And you are standing
Yeah.
in the same school.
Yeah.
Because of your, does it mean you got your job because of the expertise of which you had, or even the program of which you enrolled, that brought you a job? Or how in the...
No, actually, sometimes how I got my job is not because of what I did, is the impact that I had made. Because the course that I was taking was different, because I went much into the technology field. Sahi ni watu kila mtu anasema in technology, but I call myself around innovations. So the impact that I had was very much positive, that I had to get this, and it was coming from within me. So as I was working around innovation, as I was helping other students, then it grew within me, and I had to do a lot of research around that area. So then the university actually saw what I was doing. But jobs that are passion-driven are more and are better paying, even if they will not pay you the amount of money that maybe others will be paying, but are more satisfactory than the jobs that you actually just go for the money. And they'll open doors for you. Any question? Mimi nataka kwanza mniulize around the problems or anything about the startup. But I'm around because of time.
Maybe a question.
Yeah.
I've followed very clearly what you discussed.
Yeah.
You've summarized, you have said for an innovator to be at the point if you will be able to disrupt status quo in the environment where you live. And I believe this can be applied everywhere.
Yeah.
So, does that mean we can innovate in almost everything?
Yes. Everything, we can change everything, but we have to define what we are changing. And
do we take caution of the existing policies and regulations?
Yes. Actually, I missed one point that I need to add. There is a problem that the regulations are changing. Then that becomes very sweet for the innovator also. Like right now, if you get into manufacturing, the taxes have been reduced from 25 to around 3%. Then it becomes very interesting. But again, we have to be in the legal lines. We cannot do something illegal. To make sure that we are doing something illegal, but follow those factors. Because anyone who has anything, who buys anything, buys because of those factors. Because as a buyer, as a consumer, you buy something that solves your problem. You see? And when you have a shirt, I have a shirt, everyone has a shirt here. Because it's a popular thing to do. So it has so many users. So many people will be doing that. So that's the first factor. The second factor, shirts are expensive. They're not cheap. You look at all those things. Because the first thing when you're innovating, the innovation should do two things. Create value for your consumer and create value for yourself. Two things. That's the difference. The consumer will be looking at what they are gaining, and the business will look at what they are gaining. So, in return, unless you want to do things to help others, you use your money, you don't want to make money, then that's the only time you'll be free. Otherwise, the bottom line, you look at the value that you get from the business and the value that you're giving your consumer. Those two things are the ones that make the consumer pay, and you get to earn a living.
Yes, I have a question.
Yeah.
It's more of after you have innovated.
Yeah.
How long should you give yourself that if by that time your idea doesn't sell, you venture into something else?
There is no timeline in innovation, but there are a number of things that you need to look at. Are you moving on? Are you wasting so much time here? And are you able to keep yourself here, maybe with your team or the others? You know, the factors that you are looking at, and are you satisfied that what you are doing has someone who wants it, for you to continue doing it? Maybe you have some obstacles which are expected in business, but after these obstacles, is there hope that someone is waiting for what you have on the other side? Because that's the bottom line of business, having a solution that someone can pay for. So it's your work to evaluate, as much as you take 4, 5 years, is there anyone on the other side who will be willing to pay for what you have? That's the bottom line of innovation. And the innovation that lead to startups. The innovations that are meant to just help people, but according to the name of the center, it's innovation and entrepreneurship. That's why I'm so much into the value that you create for yourself as a business. Yes.
When did you decide to abandon actuarial completely because maybe there was not enough innovation in the area, or how was the transition?
Actually, it's for calculus. I can do 2 or 3 questions. I don't want to say much, but I'm not so much. Oh, ni wewe? Unajua hii kitu iko online, eh? Watu wasome. So that one you can ask personally. You offline. Yeah.
Yeah, thank you. I want to ask you a question on, because you have been in the field of innovating, and we know we have innovators here and we have future innovators. In our country, do we face a situation whereby you innovate something and then how easy can one patent to avoid a situation whereby you are the originator or you are the one who wants the idea, and probably instead of getting partners or whoever, the government, to assist you to midwife this idea to actuality, how easy is the process of making sure what you innovated belongs to you, even if you are not there, it belongs to you for generation to come?
Okay. That's a very interesting question. Actually, I have done a course on network intellectual property management. So I'll be very frank. A patent is very good, but a patent is for an invention. So so you have to know what you're doing exactly, because a patent has to be something that's very unique and something that has not been seen. It's very new, and it's something that it's not needed, that does not affect humanity, like something to do with health, all those things you cannot patent. So the others you can for the business. But by the time you get that patent, people will still be innovating. So the first thing, protecting your work is very good and very advised. But as a business, if you're in technology, actually if you're doing maybe an app and you want to patent, no, you can't have a patent on a software, you want to copyright that, then it will be very hard for you to stop anyone, because I'll just add a functionality here or there and maybe change how that flows. So focus on how fast you get into business, because even a patent, a copyright, will only protect you for a given maybe amount of years. But if you have something very unique, then patenting is the way to go. The other thing, waiting on the government to help you. Uliona karibu mama fulani abebo na maji, akiita serikali. You don't have to. So get your own money. Si uliona hao wadamu wa serikali alikuwa katikati ya maji akienda. So you do your own thing. Acha mpatane na government mpatane, because it's the only way. Niaje boss? Mbona waliweka TV mbele yako? Yes.
Kama control.
Yeah?
Okay, tuko hapa tu tunao.
Oh, nini mnacheza? Okay, nice.
So my question in regard to what I've listened to you, it's like number one, from what I've heard, it's like you don't have to really directly do, like, let's say for example, you did your natural science as your main course in the university. So someone is not completely restricted to what they went to school to do, as long as you have an idea. And then is that like you mean that, right? Then the second question is, if you have an idea, even if it's not directly related to what you're doing or what you're specializing, is it still okay to go ahead and learn and develop the idea even from?
I will talk about the ideas. You know, hapa kuna two things that you have to balance. For university, specifically for university in Masomo. I'll just talk about the idea. You can innovate in any field, regardless of the course that you do. That one, nothing can change that. You can get team members who maybe have expertise in other areas to come and build a team. Actually, as we continue, I'll be from Daktari. I'll come and give you a talk about something called team dynamics. Who you should choose. Savia amesema kidogo, don't choose your friends. So it's a very big topic and a very interesting one, because if you look at the applications that you have, mtu anapoda amechukua mtu wake wa daro nini, anaanza kupata interest zake. So there is a need to get someone who is as much motivated as you, because tunasema attitude of aptitude. Yeah. So they have a very strong attitude toward what the two of you are doing. Before, after akuwe na knowledge ya kufanya, because attitude itaenda far kuliko knowledge. Because anaweza boeka kesho hata kama anajua. Are we getting that? So you can do anything, build a team around anything.
I have a question.
Naona time inaenda sana. Maybe we will ask a question. Yes.
Okay, your transition from your career that you are studying to another field. How?
Actually, you know, innovation is not a field on itself. So it's just something that I did from my passion. As in, innovation is not a career. I advise people on innovation from ideation to building companies. If you saw the breakfast last week, there is a team, a startup from the Kimathi that won the National Innovation Award. They are in AI, mimi, wananiambia tu. But the only thing that I listen is the solution. The problem, the solution, does it match anyone? So, as much as you are looking at the technology, personally, I've been very interested in the problem and the solution, and how we get it to the customer. Mine will be the business model itself.
There are questions online. I think we need to respond to the questions from the online viewers.
Okay.
So I'm going to read it out.
Yes.
It's a question by an online, someone who is following online.
Yeah.
Frederick Edward.
Yeah.
So he's saying Kenneth has said that problem has to be popular.
Yeah.
Why is it that most great innovations nobody could see? It was just a guy who looked at things differently and give it a different approach. Basically, he's asking, why is it that most great innovations nobody can see them? Only the guy who gave it who approached the idea. I mean.
So when I say popular, I say a problem that has so many people have that problem. Actually, most of the time you have a problem, but you don't know until you see the solution. You need to communicate, but someone knows how you can communicate. So that's why I started way back in 2012. We were using text messages. We didn't know that something can happen, that we'll be sending text over data, and that text gets to someone. So, it's okay. So now the problem was there. The problem existed, Freddie. But now the problem is there was nobody who had defined the solution. Because although we have to get a solution, it has to be easy, it has to be acceptable, it has to be reliable, and it has to be convenient. So people have the problem, but no one has actually figured it out. It exists amongst every one of us, but no one had figured it out how to make it, or those things that I'm talking about, convenient, reliable, maybe cheap compared to the other methods, and also safe for use for humans. So those are the things. The other example is Uber. We had taxis, but there is a popular problem that when you want to move from here to Meru town, actually this Bebo may be 1 year or 2 years. Is it 1 year or 2 years? I'm at MJSK. Hii Bebo nenye nimekuja nayo hapa.
It's 1 year old.
1 year. Hata MJSK. Umesikia? Umesikia? So that you still had a problem, but you had a solution. But someone else had to bring in a solution that was way easier to do those things. If maybe you wanted to leave town, here to town, you call your taxi guy, akwambie ni mgonjwa, akwambie ako Nairobi. Then you have to call another guy to get you another guy who knows another guy who knows another guy. After you are not safe, nini. But when these apps come, you know the driver, ako certified by the company, you know the time, hizo records zimejiweka kwa database, so even if you get, maybe something happens to you, you can be able to trace. So the problem exists, but the person who makes it convenient, reliable, easy, cheap, was not there. But the problem is there, and they can see it as an innovator. Because the work of the innovator is to see that problem and be able to know all those characteristics of that problem exists. Nitakuwa around. Wacha tuendelee na program. Sindio?
Thank you so much, Kenneth, for such inspiring words. This time I want to bring one of us, Dr. Joy Rungu, to talk to us about the work she's been doing. Of course, she's very popular in innovations and researches around sanitation in the university. And I think you're going to learn one or two things from the presentation. Karibu, Daktari.
Thank you so much.
afternoon. Good afternoon. My name is Joy Riongo, Dr. Joy Riongo. I'm a lecturer in the School of Engineering and Architecture, Civil Engineering. I am the Director, Sanitation Research Institute. I have, this presentation is by two people. This I and this Mr. Dominic Kiogora, who is acting as a coordinator of the sanitation programs, Sanitation Research Institute. This institute is recently established, and it was established as a result of the work I'm presenting to you. It is just for sanitation matters, sanitation research. I'll first give you why sanitation. I deal with human waste management. I'm an expert in human waste management. Why did I choose such a field? Because of the issues that we have. We are very lucky here that you can just walk out there and flush your waste. This is not so with very many people globally. You can see like globally we have 2.7 billion people who are using on-site sanitation. On-site sanitation include the pit latrines, septic tanks, such things. We can see we have 946 million who are practicing open defecation. This open defecation, these waste just go out to the environment and treat them. Similarly, for those 2.7, who treats the waste with the pit latrines? That is why we have very high cases of diarrhea, typhoid, amoeba, and all that, because all these are sanitation related. In East Africa, the situation is worse. We have 65 to 100% of the population who are using this type of facilities. Where we are in Kenya, we have 88% of the population who are using these facilities. Those who are connected to the sewer system are only 12%. And out of that 12, only 5 of these wastes well treated. The other one ends up untreated in the environment. That is why you meet this waste in maybe you are drinking water and you're holding a bottle, you have something there from someone. So not unless we care for these people, then we just have a challenge, and a big one at that case. This one was my fieldwork sometime in some slum. In slum, you know, this is where people are in slums, like, if you go to a slum like Kibera, Mukuru, the population is very high. The population density is very high. These people are very poor. They are using toilets. Actually, about 90% of these people use pit latrines. Where do these waste go to? This is how they manage their waste. In A here, I followed these people from where they empty up to where they dispose. A, it's emptying. B, they're using some gel cans. You see, this is somebody in the toilet, even not well dressed, with some gel cans. We have B there, they put in a hand cut, and then see they pull to a river. When you go to Nairobi, the rivers you find are black. It's not anything, it is human waste. And mainly this work is done very early in the morning. So I was allowed to follow this, but it was 6 a.m. with the issue of don't close your doors. If you don't hold your nose, you can follow us. But if you have to do like this, don't follow us. So this is what happened to all those people who live within these slums. What are the repercussions of all this waste getting back to the environment? Actually, we know them. If you have the waste in the environment first, that scene, the site itself is not good. We can also imagine what that waste untreated contains. We have high cases of sanitation-related illnesses, the water pollution, environmental pollution, low life quality. People who are in the slum, the children there, they are sick. Their life quality is not, you can't compare with what you have. For you, you feel happy, you can go there, you flush the toilet. Imagine if you have to feel you want to go to the toilet, you don't have 10 bob to go and be paid because mainly it's fair use in the slum, and you're pressed, and you can't go there. Will you be happy? From morning, you only be dancing. your quality of life will not be good. So we have a lot of issues with this type of waste. So why is it that so far we don't have any advancement in this sanitation? For one, we were only thinking about the sewer-based systems. Sewer-based systems. That is what our minds were meant to think about. The cost of installing this is very, very high. There's also this cost of maintaining these facilities, which is also very high. So the high capital cost and maintenance cost, it's an issue. And then when you look at some of these settlements, not even the settlements, if you even get a place like Injiro, think about doing a sewer system at Injiro. When you go to the slum settlements, these places are not planned, the poverty level is very high. It's just chaos. So putting this infrastructure for the conversion of sewer systems, the sewer-based, is a challenge. That is why we have to think about how to help these people. You have to think about how will you get rid of that waste which has been produced by maybe the 1 million people in a slum on a daily basis. Everybody on a day, as Kenyans, produce half a kilogram of feces. So if you have 500 grams times 1 million people, how much waste is that? How is it taken out of that slum? There's no space for doing a toilet. Even emptying that toilet is a challenge because the paths are very narrow, the place is just bad. So there are all those issues. And we can also see the ground situations within the slums are not favorable. Rocky, some the water table is very high. All these are very different, needing specific interventions. Each area needs a specific intervention. You can't have an intervention that fits all. So now, what are we doing about this? For our intervention, there are so many ways of dealing with waste, fecal waste, that is collected in on-site systems. There are very many technologies that you can be able to apply. I will show you one which we apply here, which we have adopted. If you are interested in knowing the others, you can follow me and be able to tell you about this. This one is in a school which is nearby University, which is Kunene Primary School. We were using a toilet here which was full. When it rains, its location, the flood water, the storm water gets in and then the contents floods. Then on the upper areas, the soil is very loose, so you can't do a toilet in those areas. So where we had this facility, you can't dig another one because immediately the rain, then it gets filled up. So we had that challenge, help us with the toilet. So what type of solution do you think about giving these people? The soil is loose, the area is prone to flooding. You don't think about the sewer system, it's very expensive, you don't have this money. You don't think about it being a pit, you don't think about the septic tanks, you think about how will these people be able to empty and even the water. The school don't have water for flushing. So what we came up with a type of sanitation which is called container-based sanitation. Container-based sanitation. With the container-based sanitation, we use containers. It's a special type of toilet. The CBS is container-based system, container-based sanitation system. So for the container-based sanitation, the one we gave to them, we looked at the entire sanitation chain. The entire sanitation chain, when we are thinking about providing a sanitation solution, you must think about how this waste will be collected, how it will be emptied, how it will be transported, how it will be treated. You look at it in entirety. Don't look at giving them a toilet without thinking about what happens to that waste. So I said we gave them a container-based sanitation system. We used a type of toilet which is called urine diverting dehydrating toilet. Urine diverting dehydrating toilet. It's just a normal squatting pan like the one we use. We didn't want to change the toilet behavior, so you get in there and squat. But when you squat, you have two holes. One to collect the feces, the other one to collect the urine collection. So beneath those two holes, that is where you have your containers. So when you get to the toilet, you see the squatting pan, you squat. And down there where you can't see, I'm not using a pit, I'm using a container which can be replaced. I have 2 containers, one for feces, the other one for urine. Why am I not mixing these two? I am not mixing urine and feces because when you mix urine and feces, that is when you find that there is that ammonia smell from the urine. I want to keep my feces as dry as possible. When you mix them, they also become messy. Even handling them, it's not a good thing when you're handling feces mixed with urine. So I pick them when they're separate. It is a bit dry. So there are 2 dates, the containers which are beneath my pan here. And then when I collect on a daily basis, you have people to go. This squatting pan here, you can easily manage it. You lift, you close the container, and you remove. You replace with that clean container. What do that mean? These people will be having a clean toilet every day. You organize for a transportation system. So I give them the toilet, I will collect this waste, and I will manage this waste. I will take this waste to treat. And when there are 2 different fractions, it is very easy to handle my feces. Remember here, I'm not using water. I'm not flushing. Those people don't have that water to flush. So I wanted to ensure minimal use of water as possible. So when I collect my feces and urine separately, for one, have reduced the amount of waste I would have used for flushing. Most of our cisterns, the traditional ones, will take 10 liters of water. So I'll use 10 liters of water to flush 500 grams of feces. So at the end of the day, I'll be having 11.5 liters. 10 water, which should have been cleaned and used for other purposes, and only 500 grams of feces. So I want to ensure even this water which is being used can be available for other uses. And then for like the school I have there, which has about 300 students, the maximum waste I can be able to get is 150 kilograms of feces on a daily basis, which I can be able to handle in those 2 containers. This one, about 2 containers, I can be able to collect waste from all that school on a daily basis. So when I get this waste, treating it, managing it becomes very easy. It is dry and it's compact. Then for the urine it's also very easy to treat. I can also use it as a fertilizer. Urine, if it's for a population, you just get the containers you collected, you close, sanitize it. The ammonia, those in science know what ammonia does to pathogens. Then I can dilute it, I apply on my plants. I can also make fertilizer which is called struvite precipitation. I can be able to precipitate all the phosphorus in urine. I use that as a fertilizer in my farms. So when I get my feces, which is a bit dry, these are the toilets, this is what is in it. I have 2. The first one is for urine, the other one is for the feces. These are the toilets when we are doing them. This is how they are collected. This is our processing unit around the university, which is here. The pictures I have here, this is the structure, the production, the processing unit. Inside there we can see troughs. We'll see what is inside those troughs. These are just visitors who had come to visit us. When we get this waste, it becomes very easy. We use a technology, currently we are using a technology which is called black soldier fly. Black soldier fly is a special type of a fly, a very heavy converter of waste, organic waste. The black soldier fly larvae will feed on any type of organic waste. And its goodness, it's not a transmitter of diseases, simply because the adult mouth parts are not functional. Its mouth parts are not functional. So what it does, it only feeds at the larvae stage. Larvae stage, it will eat everything. The weight increases by 1,000-fold. So if I have 100 grams of BSF larvae today, in 2 weeks, I'll have converted it to 4 kilograms of larvae, only 2 weeks. That is why it is this thing. It can be able to process that organic waste and convert it to protein. Protein which can be readily available for other uses. We are going to see those uses within the presentation. So this is my fly, which I'm calling the black soldier fly. That's the adult. Definitely the adult, I keep the adults for egg production. the adults will just lay eggs. So there will be the mating, they lay eggs. The third one is eggs. We normally use pipes. They will lay eggs in the pipes. I collect those pipes. The eggs are within a period of 3 days in the young larvae. So when the eggs hatch, after about 5 days, they are ready for feeding into my waste. I have 2 structures, one for the adults, the other one for the larvae feeding. The one for the adults, I only have the adults and the nursery where I hatch my eggs. When the eggs are about 5 days, I transport them to the other unit, which is called the production. In the production, where we have the larvae, I just have traps. You can have basins, you can improvise whatever, as long as it's a container and you maintain the appropriate depth. You only go the waste I came with. If it's a trap, I have traps maybe the size of this table and this high. I just go and put, which can carry 200 kilograms of waste. I go and pour my waste there and feed my larvae. I just go away and come back after 12 days to harvest my larvae. And then the good thing with this larvae, when it's feeding, it's able to, it produces some enzymes which inactivate pathogens. We have research which has been done by students. We still have students who have been that. Following from when the waste gets in until when the larva goes out. You feed this larvae on human waste, you clean it, you do analysis, you find it doesn't do what? There are no pathogens which are retained within its body. So I have the larvae and I have. So during its feeding, I said it's very active at the larvae stage. I said from 100 gram to 4 kilogram in about 14 days. So after 14 days, the larvae is fully grown and doesn't want to feed at all. So what they do is leave the food. When they leave the food, this is when now we call the harvesting stage. If I have excess, we have a solar dryer. Just take your larvae, you put them in a solar dryer for them to dry. Very rich in protein, that's the first to 43% protein. The pupa, because I want to maintain my cycle, I have to leave some larvae to turn to pupa and then adults for the cycle to begin. So we normally harvest at the larvae stage. When we get that, then we have products. Definitely we will get products. The A is when we feed on this waste, you'll get some compost, very nice compost, which we call organic manure. Very nice soil conditioner. B, that is dried larvae. When I said you harvest, you dry. B is dried larvae. C, those are biscuits formulated for camel in the arid zones. A formulation, protein formulation. If you feed your camel a biscuit, it has its protein for the day. So when it goes out to feed, it already has the protein. D is also organic manure. Then E, this is how we are currently packaging our larvae. The reuse potential, I will show you experiments which are currently ongoing. There's a project which is currently ongoing. This one, we are formulating feeds. We decided to do value addition. This is what we have within our unit. We have formulated feeds for broiler. These are broiler. Actually here they were only 3 weeks. 3 weeks and they were weighing 2.5 kilograms. But what I can say about the experiments, there are students who are doing these experiments, Master of Sanitation students. The feed you have formulated with our larvae is doing better than UNGA, and I can proudly say that with all the data. We have a very nice feed from the larvae that you're producing. These experiments, actually this is ongoing. Right now we have sensory tests ongoing in food science. In those sensory tests, some of the chicks here have been slaughtered. These experiments, these chicks have been grown from even the feed in the market and our feed. We've seen, yes, they're doing very well. So we've gone a step further to see the taste. Is there any difference in taste or how the meat looks? If I fed my larvae on the feeder, my chicken with the feeder formulated the UNGA and another producer who is in the market, if you look at the meat, and you'll be able to tell. If you taste it, is there any difference? Because we need this feed in the market, and it must be accepted. We also have our online survey. I know so many students have joined, we are still getting the responses about this, about acceptability. But so far so good. The sensory tests are ongoing in food science. If you can pass them, you can just go and taste and tell us how this one feels like. But for me, I've eaten this chicken and I tell you they're very nice. They are there. They are there for sale. We are selling. So you can see me, I sell to you one. So this one is the other one that we're doing, fish farming. We also have catfish within the ponds there. Doing very well. We have a pond. So we now wanted to see, yeah, we were okay with the fish. So we went ahead to the chicken. So we have these feeds and this is what we'll be doing. So when you go to the shop next time, you'll be able to find our feed there. So for the nutritional value, very good in protein, that 5 to 43%, fat 37%, very nice, and very nice mix of amino acids. So for the uses of this, if you're doing it small scale, this is lovely. If you have your chicken, you really don't have to think about going to buy feeds. Protein source, we know it's the most expensive. So even if you have any, I said BSF will feed on any type of waste. If you have waste that you're producing, you have this BSF, you can be able to be producing your protein and doing your farming, chicken or whatever. If you want to also manage waste within your community, it's still a good thing to do. So just a brief thing about the social impact. If I was to do it as a business, I would involve maybe these community-based organizations or the entrepreneurs. If you made these toilets that we have, how many people can be able to buy them? You can make your income. If you decided to manage waste for like town and you supplied your toilets there, how much money can you be able to make? Even by managing these toilets, it's pay and use. That is the model that we're using to do for sanitation. How much can you be able to use, to pay, to get? What if you are earning this money? If you are managing this waste, it is money. You have your ready source of protein to make your feed. If you compare soya, making the protein by mainly we normally use soya. If you look at how the soya is produced versus how we produce this, I don't know if you can be able to compare with it. Soya, you have to go to the farm, do all that is needed for that bean to grow. For me, if I have waste, as long as I see you seated here, I'm assured I have my waste source. I'll be producing my protein every 10 days, I'm getting my protein out. So it becomes very easy. And what we see here is, we are making use of something which was not useful. Something which had very negative impact to our health is what we are converting to the cuckoo we are seeing there. So instead of saying, this is waste, that's food remains, we are going to put it away, we are going to do whatever we are doing to the environment. We convert it to something which can be of benefit to us. So as you are making this work, Just the cow manure that
Actually, I'm very excited. Now, the technology is working very well at our institution level. I'm a community person, and I believe it is the high time we cascade this in small scale or in large scale to our communities. I have seen your proposal because actually waste management is a big issue, especially in our community because there's no land. We have schools, we have institutions, we have hotels. Like, I don't know, you try to manage waste in our town. We have just half an acre land. And I think it is the right time to cascade this to the community at a cost, of course, and especially the soldier. Yes, that one can really work miracles. So I think it is time to go further for this technology.
Thank you so much, Dr.
Because it has been misunderstood by some people.
Yeah. Actually, this technology has been misunderstood. Maybe from media, if you Google, you find people thinking that the normal fly is the normal house flies. No, this is not the normal house fly. This is just a specific type of a fly. And the beauty of this fly, even if I had my waist on this trap, you will not see a single house fly. It's a magic fly. It eliminates any other type of fly, it will drive there alone. If it was a house fly, I wouldn't recommend it for waste management, simply because it is managing here. When you have something on your mouth, it will come and try to manage. This fly is very docile. It will only, when it's in that the adult stage, it is very docile. You only see it flying on two instances. When it's mating or laying. Other times, it's just, it has done what? It's just quite there. Only flying when it needs to do something. And the reason is, it knows it is not eating at that stage, and it requires energy to lay eggs. It must release a lot of energy. So it will try to preserve energy as much as possible, only to use it for the specific purpose, not just flying anyway. So this one is a very nice type of flight, and like our teacher here is talking about, it can really be used to help what we have in the communities. But like I said, there's so many other technologies that are available for waste management.
They're very expensive.
Yeah?
They're very expensive. Like me, I've installed 6 tons of water to ensure that you can manage waste. So you are saving 5 grams of feces and using so much water, and you can imagine the money I'm paying.
We waste a lot of water. We are a water scarce country. If you stand there to go and urinate, How much water have you wasted? How much was just to flush urine? Yes. And you're flushing 0.2 of a liter. If it's urine, you don't have to do this. If you read about what you already know, you can be able to seriously help our environment. Yeah.
Any other question?
Yeah. Thank you, Dr.
Yes, Professor, then next.
Yeah, I'm just wondering, when you started research, who told you about the soldier fly? Are they in Kenya, the soldier flies that we do not know they are useful? The other question is, we know human waste is infectious. What precautions are you taking in collection and transportation?
Let's take another question, then you can answer it.
It's just an addition of what the professor has just asked. Let's say like those diseases that can be transmitted through fecal matters. After already you have transported them to the place of processing. After now the process for the lab, can they still have those diseases?
Thank you so much. Maybe I can first work on that. We have a student who is who is tracking from when these pathogens come in, what happens along the way. Actually, the person went further to spiking, feed using salmonella, different pathogens, and feeding them with the larvae, BSF larvae, and tracking what happens. There will be publications out very soon because they are excreting some enzymes which are inactivating this, which are killing this, such that by the end of the treatment process, the waste that you have is safe for use. When it's coming, the load is very high. But along the way, you can be able to track the way it is declining with the number of days. But for the precaution further, for the larvae, drying of the larvae, we are using solar dryers. You know what the UV does. You already know this larvae is clean. So at the end of the process, I can hold that larvae because I know it's okay. But we still go ahead to use UV to ensure that anything else which may have escaped the system is not there. So we have a lab. Actually, we have a lab. We have built a fecal sludge management lab to ensure that whatever is going to the environment has been checked, to ensure that this waste is okay for reuse. That is the first thing that you must ensure. You can't get waste and you bring it, it's like open defecation. You bring it and put it when it's not sanitized to ensure that pathogens have all been inactivated. That is when you can talk about the use of the waste. And what I can even talk about, it has also been realized in Kenya, as we're talking, we have a sanitation policy which is being developed. They have seen that we cannot go the conventional way. We are not getting policies on reuse of these products for human waste. Because it has been said for us to realize the sanitation goals which have been set. On-site sanitation systems must be used. Not the pit latrines, but innovative technologies. Managing the type of waste that we're talking about. So we are getting guidelines about the reuse of these products. They were not there, but not because they've realized it's the way to go, then they're not being developed.
Actually, to end on, guys, we are from public health and we can categorically tell you that when you leave that waste in the pit latrine, the microbes and all the diseases seep down into the underground water. And that is why in engineering she will tell you, you will not be allowed to dig a water well below where there's a pit latrine. So I think the technology is very sound in terms of addressing the gaps which exist in our country. So if the policies come in place, it will be a plus.
Sure. The first question about black soldier fly.
There was a question about black soldier fly. I started this waste treatment in 2010. In 2010, I attended a training in Norway. In a very nice institution, there's a lecturer there, a prof, who was advocating for resource recovery from human waste. So that is the first time I saw human waste in a container. Because whichever group that goes, you leave your waste behind for teaching the next group. And he was very passionate about it. And within the area that he was in, you exchange a cabbage for human feces. This is in Norway. I give you a cabbage if you are able to give me your feces for me to put it back in the farm. That is why we started wondering, if these people, they have everything that can do this, why not us? So I got the interest. That was in the year 2020. So when I came back now, I started now exploring which are these technologies and what is this that we are running here, because it was very interesting. So now when I got into on-site sanitation now, I got to learn that there are so many technologies, black soldier fly being one of them. But there are so many others which are applicable for getting these resources back to the environment. Why I like the black soldier fly, it is very fast. It's very fast. Very few days and you have what it needs. And then the waste changes into a completely new product. You cannot be able to relate the end product and what you brought. So I like it. There's so many profs which are there. We have a master's program, Master of Science in Sanitation, where we are teaching students because we don't have capacity, enough professionals in this area. They are teaching people about these technologies. So that they go out there wherever they come from and start. Somebody will go with a black soldier fly, another will pick a different one, another different one. So at the end of the day, you'll be having enough personnel to come up with such. So this one is just one of the many.
But how did you know where you find that fly? And buy it or bring it? How did you discover where it is?
This one is a tropical insect. If you came to my place, you see it. If you go your home, where, especially if you have a place where you have compost for that organic waste, you can go and identify them there.
They are there?
Yes, they are there. They are out here. If you have a place where you have the compost, that organic waste, you can be able to identify, this is a fly, this is a fly, it's here. But if now you want for working like this, you may want a seed. It can give you a seed. Maybe larvae or a pipe with eggs, and you go start off.
So you identify from a compost pit?
Yes.
I have a technical question.
Yeah.
As in what conditions will the black soldier fly work best? When the fecal matter has the urine or when it doesn't?
When it doesn't.
So it means they are out there, but they don't work very well because of the mixing. The way our toilets are, pit latrines are made,
yes,
is that urine and actually the urine, water, and everything else. So that's another behavior change we need to bring in our toilet habits. Because if we don't do that, also it might not work.
It will not work. That's why I was saying, if you wanted to find where there is a compost, maybe a bin where you put your organic waste, but not in the toilet. The conditions
the student was being a model of toilet which can at spots separate the urine, and we can we have that?
Yes, we have. We can tell you how many we have. This project right now we are supporting 7 Master of Science in Sanitation students who are now doing their research. So in the near future there will be very many publications on this project.
Thank you very much, Dr. for your presentation. I believe it has been an eye-opener for all of us who are thinking of innovations, right? We are going to listen to one last presentation. It's a pitch from our students from forensics background. And I hope you put your presentations here. So for you, we're giving you 5 minutes. Okay? Then 5 minutes for question and answer. Then we should be able to end. Okay? Right. No. Let me see what Dr. Muti said.
Okay, come, 5 minutes. Daktari.
Good evening, guys. So, we are here with a presentation in the field of cybersecurity. So, we're going to get started. So, first of all, we're going to introduce us as a team. So, my name is Seth Marvin. I'm a cybersecurity engineer professionally. I'm also a student. And I have a blog that is Constom.tech. A lot of research is there on the field of cybersecurity and forensics and all that. I'm also a researcher that implementation tester.
Good afternoon. Good evening. I'm Sunday Juma, a student at Meru University. Web penetration tester and also a software developer.
Hello, I'm Michael Muvoi, software developer and web pen tester.
So recently we've had a couple of issues. We've had a couple of issues when it comes to industries. It cuts across a lot of industries, security-related issues. So in 2017, we had one of the biggest breaches in the history of internet. That was the Equifax breach, and it was basically caused by a forgotten subdomain that had unpatched Apache Struts remote code execution vulnerability. Then last year we had an issue with the NASA labs that there was some data leak that was caused by a forgotten Raspberry Pi for one of the projects that they were doing. And also KCB and DFT were involved in a data breach back in 2018 because of a forgotten subdomain and a web address that they had not protected. So it had got their backups and all that. So all these, we can see that it was caused due to poor visibility of assets, of tech assets that we have inside organizations. So we wanted to come up with a solution that is going to bring total visibility into what assets we have, what domains and subdomains that a particular organization owns, so that we fully understand what resources we have and how to protect them. So that's when we decided to come up with this particular framework called the Autoscaled Visibility Framework. I call it a framework, we call it a framework because it is expandable, not just for the domains and subdomains. It's expandable to network device, physical devices, and all that inside the network. So currently what we have implemented is that we have subdomain. For example, here in school we have most.ac.ke. That is the domain that most is officially registered and in Kenya. We have a couple of subdomains like student.most, that is for students, admin.most, that's for administration and all that. So we want total visibility into the subdomain. Then we also want all the services that we have and all the ports that we have, so that we don't leave any stone unturned that is not protected and secured. And then we go ahead and do a simple enumeration currently as to what has been implemented to this far. A simple enumeration, just find out what we have, directories and all that, and anything that is exposed outside there on the internet. Prevent any information leakage.
So basically, the product cuts across multiple fields, health, industries, security, and marketing and all that. Because as you know, many people are moving into development of softwares, but very many people are not considering the security part, which turns out to have a very big impact on administration and is a very critical point in software development and innovation in general. So it can be used by blue team organizations, blue teamers and people who are doing pen testing. Also applicable to admins network and anyone who might want to be able to manage properly the network infrastructure and the assets that are there. So coming to monetization, so it can run as a subscription-based system where organization can be able to pay, and we're going to be able to run the system for them and monitor their assets and report in case of any assets that look vulnerable. And most of this code we run the scans ourselves and making sure that we eliminate, depending on other APIs that might be faulty on their own, depending on the code they wrote. We want to get this information firsthand from ourselves and to be able to generate this information in a way that it's useful and meaningful to everyone, and anyone can be able to act upon it.
So quickly, we are going to do a demo because this system does a very wide scan of assets, and it also depends on how big the organization is. So it takes a lot of time. It can take a longer time, and this is one of the areas that we need to improve on optimization of the speed. So we're just gonna show a demo of what we have currently, the interface and how it works, and also what we expect to have as features as time goes by. So
what a project?
Oh, you wanted to project?
Yeah. Just project.
So when projecting, don't extend the screen. Just use normal this. So we can disconnect that.
Views of the Kenyans. Wait, we did that. But you also say in your CV that that constitution was
Then the camera should zoom to the screen. Okay. Good.
Okay. So So currently we have created a small web interface to be able to interact with this data. So the advantage of the system we're creating is that it can be built upon and attached to many forms of input. So Telegram bots, Android people, and also web. Anyone can be able to interact with it because it's an API. As long as we get back the data, we'll be able to build upon it. So, as we had said, the scans may take a little bit of time, but we had simulated some data for the purpose of demonstration. So, I'm going to move over to recent scans that have been performed. And as you can see, there are two domains that that we had worked on, and IP Africa and Lipapay. So, as you can see, when you are able to display some details about the domains. So we have a small dashboard over here.
Proceed.
So as I was saying, we simulated some data for this purpose, and as you can see, when you run the scan, this data is being retrieved from I think DB, because this system currently has two parts: the backend that does the scanning and all the enumeration, and the dashboard that is displaying. So they're all communicating through the DB, which is running. I'll show you in a few. So this is basically what you get when you run a scan on a domain. You want to be able to see available IP addresses, the ISP, the ports, the services that are running, and all the banners. So those who have done some part of security can be able to interpret this data, and it's really critical during information gathering when you are in the stages of enumeration and you want to find your loopholes. So this includes assets that are owned by the organization. So from here you can be able to see that there are several reports that are open. You can be able to check out the services that are running. You can be able to, so this helps you to be able to come up with a better visual image of what you're securing or your organization assets. So the next part of it you can click on the subdomains. Currently, it's integrated to the I think DB dash API. So from here, there's a couple of information that you're able to get. So when you run the Data Explorer, you can be able to see that there are further searches that we are conducting. We're able to brute force directories. We're able to check on subdomains and if they're live or not. And all this is being relayed to the database from the backend. So for now, we have not yet visualized it all one into one DB, but through I think DB dashboard, I'm able to check out. But as part of the future work is to be able to come up with a proper visualization tool that can help you to manage and have a look at all these assets.
Yeah, so basically that's it. Because of pressure and we wanted to have a prototype, a working one for demonstration, we couldn't be able to have it in time. So that's why we just have the data, but just the part of visualization that is remaining. So that's it. So any questions?
So I have two questions. Yes. One is something you asked yesterday actually. So what is the CVSS you are using for this?
Okay, so this is not a vulnerability scanner.
Okay.
Or to be clear, that's a nice question, but this is not a vulnerability scanner. This is a visibility framework. We want to just gain visibility into what assets are available, what's running on those particular assets, so that they can be able to help both the blue team and the system administrators to know what actually they have exposed outside there. Yeah.
Okay. The other thing is, who are your current competitors right now?
Current competitors, not any that you know, but basically for current competitors, you'll find that it's just individual tool developers. Like you'll find somebody has developed a tool to try and get the subdomains, but leaves it at that, or try to create a tool like Nmap and leaves it at that. So what we were doing is that we wanted to bring a full visibility using all these particular concepts into one particular framework. That's why we call it the visibility framework. Okay. So yeah, I believe currently I haven't come across any of these.
Okay, so it's limited to web applications only.
As I said earlier on, is that for the start, this is what we had for the prototype. But the fact that we call it visibility and not web visibility means that it can be extended to other particular things like network devices, IP addresses within the network, or all those other particular assets.
Final
so currently,
Final question. Will it be host-based that I can download it onto my computer, or is it cloud-based, meaning that you're the one who will be managing it?
Yeah, so as we had seen there, it was something, as we had seen on the monetization section, we will maintain it as cloud-based as for now, so that we will run it as Autosploit visibility as a service. So it will be hosted cloud-based as a service. Yeah. Any other questions?
I have a question that might escalate to many other questions. How reliable is your idea or is your prototype?
Basically on a scale of 1 to 10.
How reliable is it? What would make me choose it?
Yes. So first of all, as you have seen, there are not very many alternatives that try to work with all these techniques. Most of them are separate. Instead of having to run multiple scans, if you have this option that can be able to produce a very good report for you based on one simple scan, I think it will be way faster because time is the greatest resource.
And also, to answer that question also, considering the experience that we have had working in cybersecurity professionally, we realize that this particular solution reduces a lot of things through automation and all that. So it reduces maybe a task that would have taken you 3 days, 4 days to complete to just maybe overnight. With an increase and enhancement of the particular features when it comes to speed, then it can just be reduced to a couple of hours and you have it. So in terms of reliability, I give it a score of 8.
And can an ordinary person who doesn't, like let's say I own a website, can I use it? Like if I don't know anything to do with cybersecurity and all that jargon, can I use it as somebody who did statistics, for instance?
Okay, so I think that's a good question. So this can also fall on future features that we may add. So we might have like after scanning, and we can implement a way that we can recommend some steps that can be taken, or even the fact that you get an alarm or an alert before anyone else maybe had access to such assets. I think it falls in a very big way in mitigation, and we try to keep it as simple as possible. So even if you're a developer, there are some terms, if you made the system, we try to put it as simple as possible for you to be able to understand what really is happening and what's wrong with the system.
And my last question is, since probably there's somebody somewhere watching you guys and is like, this is a good idea, I want to invest in it. Like, how much could propel you into the market?
Money-wise?
Yes. And in that, what ratio will you give him? Because investors would like to be given a ratio vis-a-vis the amount, so that they make a decision based on that.
Okay. That's a nice and a heavy question, to be honest. So for now, we really wanted to fully come up with a system to make it functional, at least on the most basic level. Then considering the monetization of this particular system, we realize that the answer to that question will vary from industry to industry. So if it's about investment, then maybe on the cloud platform, you can just get if you can just get support for the cloud platform, that is AWS or Google Cloud and all that. So generally, that's not a question that I have an answer to right now. So maybe if my colleagues have an answer to that.
I think we'll look into that.
Thank you. Okay, there's this thing called, I guess you're familiar with, Pretty Recon. So it's, will you be like, they have packages, annual packages, monthly packages, pro, the other ones, will you be, do you think, are you planning on having something like that one?
Exactly.
Yeah.
Yeah, exactly. Something like that. Subscription based and all that.
How are you planning to make money?
Yeah, that's what we are discussing. Subscription based plans. So you will find that there are those organizations, let's say hospitals and all that, that have sensitive data, but they don't have the technical know-how. So what happens to those particular industries?
What do you mean by technical know-how?
Maybe they don't have the technical people who can be able to do this for them. So what we do is that we offer it as a service. It will become a managed service. So we manage the service for them. Then we just give them the reports. That is on their subscription. Yeah.
The hospital, I think, has a lot of many categories of data and different departments, for example. So what specific data is that department?
Securing, mostly it's the personally identifiable information, PII, that shouldn't be exposed outside there. So hospital is just one of the examples out of many industries that we have. That includes hospitals, schools. We have a couple of industries that we're targeting.
Yes, Jihya.
Yeah.
Oh, we start with Paul.
Okay, I have a question. What are the underlying factors that determine how long a scan will take? And the other question is it possible to do a partly scan, like maybe on one domain, or is it all the domains you want to scan?
So when it comes to time of the scan, this is where we come to the next part of the prototype with the optimization. For now, we came up with a system that will run smoothly for the demonstration, but with tweaking and some few modifications to it, there are a few ways in which you can heavily reduce that scan time to something that is accurate, that is more practical.
And also, when it comes to the factors that will determine how long the scan is going to take, it also depends on the organization. Let's say we were contracted by Safaricom to do a visibility analysis for them. We realized that Safaricom has got loads and loads and loads of subdomains and IP addresses that they own within their net block, ASM block. And if you compare that to what let's say Meru University has, you will find that Safaricom is gonna take longer time compared to Meru University. So maybe the size of the organization and also the asset that they have outside there on the internet.
The other question is it possible to do partly scans, like maybe on one subdomain or something like that, or maybe on departments? Yes.
We just do it on positive ways because we want total and full visibility. So yeah, full visibility means all the domains, all the resources, all the assets.
Actually, mine is some comments. Because the team, I believe in what you're doing because the technical part, you were very good. But actually, as a layman, I cannot understand the solution that you are offering me. You made it so technical that if I had any of maybe the things that would require your services, I could not even understand. So the thing is, make it friendly. Be focused on the solution. If today you are to talk about what Safaricom does, we can say it sends money from one person to another. But if we start saying this is how money goes from this stage to this stage, then you lose so many. So I want you to be breaking down your solution. I know this is a big space, a lot of money is going in there, but you are starting and you have a chance. But break down the solution, let people feel the solution. Then if someone wants to go deeper, then they can get there. The next thing, if someone asks you a question, don't be defensive. We are the customers, and we are the ones who are right, even if we are wrong. So don't be defensive. Act as if we don't know, act as if we are new to this field, and feed us the information as if we've never heard of what you're talking about. Is it okay? Yeah.
Actually,
and,
to end on what my colleague
and the guy,
the guy at the center.
yes, man, don't pocket when you're presenting. And don't be a kid.
I was saying, guys, you are doing great work. But as he has said, you've seen a floated. Because the guy has used very technical terms. In medicine, we call it demystifying medicine. Make sure you demystify your field so that any person who is walking around can understand. Like I was asking here about the seeds. Is it going to be used in the bags? You get? Yeah. So make your presentation simple, make your ideas simple. And that is how they are going to earn money. Because I've heard from my colleague, this is all about making money. We are not doing this for fun. Yeah. So it's making money. And when we hear about cybersecurity, I was thinking about my phone. You see, these days, guys are cracking even into people's phones. Huh?
So you might not even be thinking of doing this. Start with our phones. Right? Can I subscribe to it?
So forget.
Like I use my phone for all the business, including my bank account is here. I'm linked to my bank account. And I've been very resistant to my banker not to link my phone with the bank because somebody can get in my phone, crack everything and back. So please link in that direction.
So to just add something. On the user-friendly part, that's I think what we're going to work on during the dashboard. Reporting, I think, is very essential to this, to be able to put all that technical terms in a manner that anybody can read it. So I think I will heavily build on that, the reporting part, and to be able to come up with something comprehensive and good that the technical team and both the managing or the other user team can be able to understand. So thank you for the input.
Yes? I have a question, but maybe it's something that we be thinking about it for the future. Like now you'll be scanning these information from these big companies, right? To get it so that you can understand where they have to do more with the security, right? Okay, my question is, like now, have you thought of you being hacked and people getting the data? Or what security measures are you using, you as people, with the system?
Next question. The fact that the system will be used, might get used by big companies and will be retaining their data. We have a module for encryption, so all the data that is at state shall be encrypted, well encrypted actually, using very good encryption standards. So data has to be encrypted. Every data will be encrypted.
So have you already introduced in the system?
Yeah, it's a module that is we are working on. So because of the presentation, I'm just started. The idea has been there for quite some time, but for the code, we just started recently to try and do the demo so that people at least can explain what we are trying to think using a demo. Yeah, it's a work in progress.
Thank you.
Any other person with a question? Okay. So we have come to the end of today's session. A very engaging day. We began in the morning with the keynote speech from Dr. Alice Kikulan from Zitech University on disruption of technology, and we've interacted with a number of persons who've really achieved a lot in the field of innovation. So we believe that students who are here physically and those who've been following us online have been able to grasp something in the process. So tomorrow will be the culmination of our Innovation Week, and we expect a number of guests to be with us tomorrow. And the venue, because of the pandemic, we just have a few seats inside here. But also, if you would come to the Innovation Center, we have several floors with sitting space, which you could be joining through our Wi-Fi and follow us virtually. And we have a number of representatives from the university management and invited guests who have already confirmed their coming. So we'll start as usual, same time tomorrow, and I'll sit with my team to share, especially with the innovators, our final program for tomorrow. We'll have to listen to a few of the best presentations that we've had in the entire week, and give major announcements tomorrow. So for all the participants who've been joining us since Monday, you're welcome tomorrow as we crown the entire event. Any questions from? And I want to really thank the media team for covering the entire event since Monday. You've done a very good job and we really appreciate. So tomorrow, let's do this again. And like I announced yesterday, we'll keep on doing this through our schools until we culminate to a week-long innovation week after cutting across all our 8 schools in the university. And of course, like you can see, Kenneth Njike is here from the Dantimati, and many other guests that we'll be interacting with over the week. So we'll also, there are other events that we'll be scheduling together with him between our institutions, so that we can continue the innovation mind. Let it not stop today, let it not stop tomorrow. Let this continue throughout. So I don't have any other thing to add on. I just want to request someone to pray for us. Any volunteer?
We'll just pray.
Okay. Let's stand. We'll be sitting for
Let's bow our heads and pray. Father, Lord, we thank you, God, because of your mercy and your love, God. Thank you, Father, for the good time, Lord, we have had throughout this session, God. And my Father, we come to the end of this session today, God, my Father. We bless you because you have protected us, given us the good ideas, my Father, Lord, we have shown us yourself at this point, God. Even Lord, as we depart from this place, God, we pray for more protection, good health, God. When we meet again here tomorrow, safe and sound, God, we glorify your name because you're great. In Jesus' name we do pray, trust and believe. Amen.
Thank you very much. Forensics team, I think, will